right now. I'll wait. Call the roll. Here. All right, thank you. All right, this is what we're going to do. Before I bring everybody else up, I'm going to do the legislation first. Hey, Francis, how you feel? This is to here. Before you activists came in and started being activists, Francis Mills was activist for a long, well, now I don't want to put us like that, but for a long time, working in the community. She didn't ask for any dollars, anything, what else, and she was dealing with lead issues and health issues in the community, working hard, giving back to the community. Didn't look to anything in return whatsoever. She would just help. And at that time, I was doing the fatherhood movement. We were doing that, and at the same time that Chris Harsh was out in the neighborhood as well, because he was battling lead. Oh yeah. And I'll tell you something about Chris later. Matter of fact, I can see it now. He had me protesting in front of Sharon Williams, the president of Sharon Williams' house. He did. He saved a lot of houses in my neighborhood, battling with foreclosures and things like that. And he was with Acorn at the time, one of the biggest radicals around. It's this guy right here, Maverick. He's a Maverick. But I like seeing Francis. So we'll do this legislation. I have, after that, and then we'll move to the other agenda part. And I'll have Kyle Early here for about 10 minutes. I just want him to explain a beautiful program. We'll go into the arts, and then we'll come back into lead. And I know about that piece. I'm gonna get with you on that, what was it, $3 million? Is it from the state of Ohio? We'll draft a letter to the, I'll talk with you, and if we have to draft a letter to the governor or something like that, and that we'll go down and talk with him. We just won't lose it, man. I mean, he's a good friend of mine, too. Yeah, we'll text him. We'll talk afterwards. Okay. Yeah, we'll talk afterwards. I don't like losing. So, saying that, ordinance number 103, 2026 have been approved by the Public Health, that's you, Director, Finance Department, as well as Director of Law. It's an emergency ordinance authorizing the Director of Public Health to apply for and accept one or more grants from Cuyahoga County Invest in Children program for the first year Cleveland to conduct Moms First project service under the Invest in Children partnership and first year Cleveland partnership programs, and authorizing the director to enter into one or more contracts with various agencies, entities, or individuals to implement the grants, as I said earlier. The health director, David Margolies, the finance director, as well as the law director approved this grant. Now it's up to us. Director?
Great, thank you. So this is an accept and spend legislation for Moms First from two sources of funding, First Year Cleveland and the County Invest in Children. And with me to my right to answer any questions is the Commissioner of the Division of Health, Equity, and Social Justice, Commissioner Lita Wills.
Yeah, it's good too. When we met about that, you do a good job, you know. I'm gonna yield real quick. And you got some fathers in this as well, right?
Correct.
You know, I push for the fathers. All right, listen.
Good morning, Chair and committee. As you're all aware, we received several funding sources to support Moms First, which is our Healthy Start program. That's been happening for a number of years as the city's general fund, as well as Invest in Children from Cuyahoga County, and First Year Cleveland dollars stepped in to fill a gap that was created when federal funds were slashed maybe it's been 10, almost 12 years now. So these three sources help to make up the rest of those funds to keep the program whole. The program is a home visiting program for pregnant mothers, expectant mothers, their partners, fathers, family members, anyone who might be taking care of the child in the home. It's home visiting where each family gets a dedicated community health worker that makes contact with them and comes out to visit up to 2 times a month, but also has other contacts with them, making sure the family has needed resources and referrals for services, making sure that prenatal medical appointments are kept and attended to, making sure that things like transportation are provided if necessary, clothing, equipment for the babies, lots of education throughout the pregnancy. We stay with the family until the baby's 18 months old, and we're constantly cycling in new families, new moms, new babies with new healthy pregnancies that are the eligibility is just that you live in Cleveland. And so we've been providing this program since 1998, and this is legislation that would allow us to continue to accept funds from Cuyahoga County and First Year Cleveland to add to our overall program budget. Happy to answer any questions.
Have in the health department, trying to think what this is called, where they evaluate to make sure the grants are on point.
Yes, audits, right? Are you, so?
No. It's called a different name, and it's 501c3, not for profits. They don't audit. They make sure things are on point.
Like a financial review?
Yeah.
Kind
they do
of.
progress reviews constantly to make sure that we're meeting our benchmarks.
Sure, I can, to the chair, I can speak to that. All of our grant program fund, with our funding sources, require us to do quarterly and annual reports. They review our data in terms of the number of folks that are served and who participates. They also take a look at how we're spending the money. In addition to that, the fiscal team at the Department of Public Health also conducts audits, which they are just beginning a session with Moms First, just to ensure that all of our compliance measures are being met.
That's what I'm looking at, compliance department. Do
Yeah.
we have a compliance department?
I don't know that we have a compliance department, but law handles compliance, but also each grantee and subgrantee, we manage the compliance efforts for our contracted agencies like Merrick House, First Year Cleveland, Friendly and Settlement House. We make sure that we're reviewing their invoices properly. They are required to report to us monthly.
That's not what I'm looking at. That's not what I'm looking at. With compliance, you have goals and objectives to meet on
programmatic
every
compliance.
right in every grant that we receive, and so compliance will make sure that because sometimes grants and the goals and objectives can change on you, but that compliance department will make sure that we're hitting our benchmarks and we're reaching our milestones, and everybody is there. And the law department cannot do that because they're not experts to do that.
To the chair, yes. The Moms First project has internal staff that's dedicated to executing the projects and programs. So we have an epidemiologist on Moms First that tracks all of our data. All of our agencies are required to report to us monthly regarding the folks that they see. We have a protocol and procedure manual that they all have to follow so that we're giving the same program throughout the city. The federal government reviews our data on a monthly basis as well. And all of that has to match up with how we're spending the money, right? So our goals and objectives have to keep it. And so not only are we kept in compliance through our federal grant, but these two grants as well, Invest in Children through the county and First Year Cleveland, we have to report back to them. So this is why we have to keep such tight measures on our compliance, not to mention the training that goes with compliance, making sure that everyone knows what our compliance measures are and what they are held accountable to, for sure, yeah. And all of that gets compiled into an annual evaluation as well.
Is there a way we could have an alumni group, for example, when they graduate, you guys do what? And then with the alumni group, you bring in the fathers in there as well.
So right now we have something that's called the Civic. It is a Cleveland Infant Vitality consortium that consists of interested parties. So some of our funders are at the table, but also the folks who work within Moms First or in other early childhood programs, but also people who are currently enrolled in Moms First, dads and moms, and also alumni are a part of this grassroots effort to find grassroots solutions to really social determinant of health issues that they know arose during their own pregnancies, during pregnancies and pregnancy issues throughout their community. So we're working on that. Those folks stay engaged throughout, we're in our second year now of that particular advisory group. We're more than happy to connect you with those folks to talk about how the program affected them. We have a couple of Moms First alum who have gone on to become CHWs themselves. I know one that has gone on to become a doula. And so we are very much trying to keep in contact with people, but also to make sure that once their time in Moms First is finished, if the family still needs help and resources, we have referrals that they go to the next level of that in-home support, or throughout the course of their time in Moms First, they also get a lot of opportunities in terms of being able to enter job training, being able to enter educational programs, along with the education that we do and outreach around their physical health during their pregnancy. We are also looking at those other aspects of life as well.
I want to have me invite me to the graduation, all right? And you guys are working with the fatherhood group?
Yes.
Boot camp for dads?
The boot camp for dads, typically the hospital connects the family to that. We have a fatherhood program of our own, which I know you know Ronald White of the Transparency Project. He is the person that handles our fatherhood education program. And so every person that comes into Moms First gets a referral for the fatherhood program. Mom and dad do not have to be in a relationship for dad to have those services as well. And so all of our sites refer to the Transparency Project's fatherhood program.
That's very important. Engaged. I'll yield to Councilmember Harsh. What happened to the mobile we used to have? We were talking about getting, Director.
Through the chair, we have 2 mobile units, and we've, they're out in the community. They've been in Glenville, run through several divisions of the health department, and doing great work.
We have this program with them as well.
Absolutely. Yep.
We walk or whatever, Director, we'll see the
Oh yeah.
the health mobile.
It's just been cold.
All right.
And these mobile units don't do great in the cold, it turns out.
No, they don't do great in the cold at all. It would be nice if we could, some kind of where we have someone grab a jobs board and put that right in the health mobile as well, because jobs is correlated, and jobs, when you get it, put people to work, is therapeutic, and that's very, very important. So that if we can have that in there, that's there. I want to yield to Councilman Harsh.
Thank you, Mr. Chair. I'll be very brief. I think I shared this story the last time Moms First was at the table, but it bears repeating. This program warms my heart. I'm very, very proud of it as a resident of Cleveland and as a legislator to vote for it. My wife delivered our youngest son at Metro Health Hospital about 10 years ago. And there was a young lady in the room next to us who unfortunately didn't have any family visiting her, and she didn't have a guy coming in, and she was pretty much there by herself. But the only person not the only person, the hospital staff was obviously very good, but the only visitor she had was Moms First. And I know that because they came into our room, and we were like, hey, third kid, we're all good. We've been through this. But I know that they spent a lot of time with her, and were there for her. when unfortunately nobody else was. So that always will stick with me forever. And I think it's a really, really good thing that we are able to do this for the residents of Cleveland. And I'm very proud to support this piece of legislation and the good work of Moms First. So thank you, Mr. Chair.
That's great. That's fantastic.
There's no question involved.
Yeah, you got a chance to see it, man.
Thank you, Mr. Chair. Through the chair, I have a question. Does the program include in-home support for breastfeeding mothers, in particular Black and brown mothers who have historically faced systemic and historical barriers to breastfeeding?
Through the chair to the councilwoman, yes, there is extensive breastfeeding education that happens, but also connection to resources. There are in-person classes that they can attend, but also just that having that support and that coaching. We also have used in the past an app that women can utilize to kind of help encourage them, but also kind of track their progress with that. We also make that a part of our outreach and education just in general in terms of public health messaging around breastfeeding. And so yes, that's a pretty large thrust in terms of the outreach that we do and education that we do and support for moms and families.
Thank you for that. It's very important. You know, I breastfed both of my children, and I know that if you don't have the community or the familiar support, you know, often you're floundering once you get home. So the in-home support is crucial.
Through the chair, I would also add that we also make sure that every mom has a breastfeeding kit, because the materials that you need to be able to do that successfully sometimes are cost prohibitive or inaccessible. So we just make sure that that's gifted to them.
Amazing. Thank you.
And we have the Fatherhood Conference. Reach out to Al Grimes.
Yeah.
Are you guys a part of it? You ever been a part of the Fatherhood Conference?
Our fatherhood, to the chair, our fatherhood coordinator attends it, and I believe several Moms First programmatic workers have attended, and our internal City of Cleveland staff, I'm sure you remember Lisa Matthews, and then our internal programmatic staff have attended and sometimes presented, depending on what's asked of us.
Okay, great. Councilmember Shaw.
Good morning. Thank you, Chair. I appreciate everyone's time here today. I had just a few quick questions to the director through the chair. I see here that we have the 2024 numbers and how many babies were served and families were served. Do we have the 2025 numbers?
Through the chair, not just yet. Infant health records tend to be a bit staggered, especially the infant mortality rate, and so it takes a couple of months for that to get compiled, and we just got into February. But we are working on that, and then also we are preparing our annual report for our programmatic numbers in terms of how many births we had, how many moms and dads were served, how many babies were in the program, even if they weren't born in this year. And so that will be available in a few weeks, we expect. Infant mortality rate may take a bit longer, though it's typically a little staggered.
Okay. No, I mean, the numbers themselves are, quite impressive. And from my understanding from the legislation, to the director through the chair, this is for accepting the grants. Does the city itself fund this program?
Through the chair, yes. Yeah, I think we authorized that legislation with you all in December. No wonder. It all feels very deja vu. Yes.
And how much was the city portion?
Through the chair, the city portion is, I believe it's upwards of $450,000 annually.
And like I said, the numbers, 196 babies born in 2024 that were supported, 691 participants, including mothers, fathers, and infants and their families. How does intake exactly work? Do we have people that we have to turn away because of a lack of funding or resources?
Through the chair, not typically through a lack of funding. If we've ever had to turn anyone away, it's either that they don't live in the city of Cleveland, and in which case we're not saying we're turning them away. We will service their immediate need and then hand them over to an organization called Bright Beginnings that does this same type of referral process and service throughout the county. And on a rare occasion, if we are full, like maybe we have a couple of CHW vacancies, and so we may have to pause, but that's been rare. We do have a couple of vacancies right now at our Merrick House location that are being filled, but each CHW carries a minimum caseload of 30 at any given time, and so we're pretty adept at taking on new folks. The process is people can self-refer, they can be referred by their hospital, they can be referred by other community service organizations, and basically, usually they call in, but they can also sign up on our website. But those are all taken off by one of our administrators who takes a look at the information and decides where is the best place to refer. And when I say best place to refer, I mean that Moms First is provided in partnership with several community agencies throughout the city. So if it is a Central East Side resident, they're probably going to get referred to Friendly and Settlement. If it's West Side, it's probably going to get referred to Merrick House, and trying to make sure that we're coupling them with someone who's going to be closest to them, although it is home visiting, so we go where they are.
No, that makes sense, and I appreciate the answers. I want to make sure that if there is room for the city to increase, I mean, this is such crucial work, and we shouldn't be turning away any families or children. I generally don't like to use the word investments when it's about people, but these are investments in the future of Cleveland, so it's important. Just my final question is regarding the pay scale for case managers. I see they're being paid $24 an hour. Is that correct?
Yes.
And is that on average? Does that meet what the private sector is offering to individuals? Are we seeing turnover because of the pay?
Through the chair, it's been about 3 years now, 2.5 years, that the program overhauled its minimum pay recommendation. Again, this is the minimum. We contract with our agencies through using these grant funds through contracts. If their organization has a different pay scale that requires us to make that increase, or we do that, but that's the minimum. I believe right around COVID, you'll remember that minimum wage of $15 was progressive. Right after COVID, not so much. We realized during COVID the value of a community health worker. At the time that we increased those case manager and community health worker minimum hourly wages, at the time that we did that about 2.5 years ago, that put us on par with the hospital systems, and I believe we were above. The average was 18 at the time, but it's been a couple of years, so
Okay.
we will be reviewing that as well.
No, that's great. Thank you for the answer. And I think I would just urge, we make sure we keep an eye on that to help prevent turnover and, of course, support the people that are doing the work on the ground. Thank you for your time.
Put together this, will you finish, Council? Okay. Who put together the detailed budget and narrative? I like seeing things like this. A lot of times when people come to the table, they don't show you the numbers or any outcome measures or progress reviews, but you have this in here, so when people, if they read it, you see what's going on like this. And you have, when they're gonna hit the certain milestones, you have the salary rate, the level of effort, which is good. That's very, very good. Good job. Councilmember Joe Jones.
Thank you, Mr. Chairman. To the group, good morning. Looking here, I guess my question would be, the numbers, the immortality numbers. Do we have those?
Through the chair to Councilman Jones, after my last presentation at the table, I believe it was in December, No, it was January. I take that back. You did ask for some broken down rates, and I sent those through your administrator with infant mortality rates that you requested back to 2017 by ward. And so I had sent those about a week after my last appearance, so you should have that information.
Who did you say you sent them to?
To Ibukun and the second administrator.
Well, you didn't send them to me. And so if you could be so kind to send them to me, I am on my email is on all of the brochures. If you could be so kind to send them to me, I'd be so appreciative of that. It's Joe Jones at clevelandcitycouncil.gov. If you could send that information to me, that would be appreciative. I want to go into really drilling down on this issue because it's still a major issue for our neighborhood. Our citizens are concerned about it.
Councilman Joe Jones, I'll make sure you get it, but you know what you have to do for me? Do the
Mr.
chair. If
Chairman.
you don't go to the chair, you leave me out of it.
Thank you, Mr. Chairman.
All right.
Mr. Chairman, to the distinguished lady, I'd appreciate it if I could get that information. I came here, Mr. Chairman, in 2017, 2018, and this issue of infant mortality, and it's still a major issue for African Americans in my community. And the numbers were so dismal, unfortunately, for our country, for this great nation, to have African American women suffering in such a way where we were worse than third world countries in the Lee Harbor Ward 1 neighborhood. I had never seen anything quite like it. And so I wanted to get a chance, Mr. Chairman, with all due respect for the distinguished lady, if I could compare and contrast those numbers. How have we improved would be the next question, Mr. Chairman, to the distinguished guest who knows those numbers. How have we improved?
Through the chair, I understand. I will ensure that those are sent directly to you, although my instruction when sending anything to council is to send them through the designated council staff, that is to send them to all of you, but I will happily send that to you. How have we improved? Well, we're a far cry from seeing rates of 24 or 28 infant mortality rates in our city, but the numbers do fluctuate. We've been hovering around 13 or 14 percent per 1,000 births each year. Sometimes we get as low as 9. Within the Moms First program, we hover around 4 or 5. Sometimes it can go as high as 6. The reason why we have these fluctuations, and you'll see it when you see that year-to-year comparison, we're talking about relatively small numbers, and when we amplify to be able to look at a rate, we're looking at deaths per 1,000 live births. What that boils down to is we are obviously not having that many deaths in every ward. Last year, I believe the last full year that we don't have the 2025 number yet, was a whole number of 52 deaths across the city of babies before they reach their first birthday. What that breaks down to is less than 10 in each ward, and so even one will make that rate go, a huge percentage higher. And so you have to kind of keep that in perspective. Where we've improved is in understanding the problem, understanding who is most at risk, and making sure that we're able to put resources in place. We've improved in terms of education, not just for social service providers, but for medical providers, for hospital systems, for our managed care providers, for Medicaid providers, to understand that just by virtue of being pregnant and being a Black woman, you are at risk, right? And so being able to tackle the problem on this large scale and pull every factor in place to say, this is what we need to do. This is why we monitor it so closely. This is why infant deaths are investigated. We know that prematurity is the largest cause of infant mortality, and so being able to do what Moms First is doing, if I could amplify Moms First so that everybody got it, I would. I think that's because we can see that the care that we provide is able to reduce that number. And so I would say that being able to stabilize Moms First from any blows that we've had with regard to funding so that we can continue to expand our footprint is how we improve.
Mr. Chairman, you know, my suggestion would be that we would have maybe our guest here give us a presentation on it overall. I know that we're sitting here, want to make sure I'm clear on what we're doing in terms of this particular legislation, Mr. Chairman, but it would be good to have a presentation on the issue so that the viewing public and those who are interested in the subject have a better, clearer grasp and understanding of what the fundamental issue is and why we're actually here funding this particular program. So,
Good. You know what? I hear what you're saying, Councilman. Have you to come up and to present, and what you're narrating also, I sit back and I listen to prevention. And sometimes prevention is hard because your numbers might show 50, but if you didn't do it, it might be 250. And since you're doing prevention, it gives people a chance to understand better. I was listening to you narrate.
To the chair, can I tell him what we talked about? After my last presentation here at Health and Human Services and Arts Committee, I got with my partner commissioner, Commissioner Mills, who's over our health division and has done extensive work in this area as well. And we thought it would be great if we, including infant mortality, including lead, if we got together and prepared an annual report for council that would show you all of those rates and all of the data that you need to know by ward, but also allow us to come and present to you about what are those efforts, what efforts are going on behind each of those issues. And so maybe we would be covering like 5 major health issues in Cleveland, but I feel, and Commissioner Mills and I have discussed this, she feels the same way, that it would be helpful if on an annual basis, your public health department is able to present to you the updated stats, but also the efforts that are going on, and also talk about any policy and advocacy areas that you need to be aware of yourselves as council members. And so we're preparing getting ready to put together a report that we would present to you, but we would be happy to come and chat through those issues in person with council if you'll allow us.
And I just sit this right here for
Talk about infant mortality. Moms First is only a piece of the pie of the whole network of individuals. In November, we were here with First Year Cleveland to talk about funding for that program, which is sort of the coordinating entity that works with all of the programs, all of the doula programs, all of the hospital programs as a funder, but also as an innovator and a planner in terms of what we want to do with Medicaid, what we want to do from a county perspective. And so when we say, let's have a conversation about infant mortality, we need First Year Cleveland, we need the doula programs, we need the hospital programs, all at the table at the same time so that you can see how they all work together, because nothing happens really in isolation. If we say, how are things better than it was since the inception of First Year Cleveland, the system has completely changed. We had a few programs that did this work, but funding has increased. We have better hospital serving programs. We have criteria that the hospitals are working to operate out of collectively. We have new things happening in terms of the availability of doula, and then just Black women serving organizations like Village of Healing. So when we say that, it's not just Moms First. Moms First was the flagship program for infant mortality since 1994. And so exponentially, we have gotten better. Even though the rate fluctuates, things are so much better than they were in 2016 when we first started.
So, Commissioner, we'll do it in April. April is Minority Health Month. Put your numbers together, and we'll do it there. Maybe presentation here, or we do an event program or something like that. That way we'll move it forward.
Mr. Chairman, looking at this piece of legislation here, just want to make sure I'm clear here. How much is the total for it? And I see a couple of different numbers.
Chair,
Total
Commissioner.
amount that we are asking.
Through the
to
chair,
be
there are
accepted.
two sources of funding, so it's up to $900,000 from First Year Cleveland and up to $600,000 from Invest in Children, which is the county, over a 2-year period for both of
And
those
then
numbers.
the city of Cleveland matches at 400. So what's the total?
So, go for it.
Through the chair, we are at, I believe it's 1.9 million if you include the federal Healthy Start grant, which is 1.2 per year, which is 1 million per year.
Do a great job. So we'll add that in when we do what we do.
Yes.
So this is a citywide program, and Moms First I want to make sure I heard that right. Moms First has been in existence since 1994.
Through the chair, yes, and I believe we got Healthy Start funding for the first time in 1998.
1998. And then you talk about in the program, and you don't have to go into depth, but these would be things that I would want to know, would be, you say you improve the woman's health. So what does that mean? The second question I would have is improving the family's health. How? So that would be a question I would like to know about. And if you want to say something, Mr. Chairman, to the director about it now, that's fine. But if you want to give it to me later in a piece, that would be fine too.
We have time constraints
Okay.
right now.
Sure.
And so, Mr. Chairman, one of the things that's really important to me is really fundamentally understanding how this program really works. And, again, what is the cause? So, Mr. Chairman, I would ask the question, what's causing infant mortality to be what it is in the city of Cleveland, and in particular in my area?
Could you do me a favor also when you narrate it to him, to the councilman? He has community meetings also, and just go to his
Of course.
He doesn't mind that. Joe does a great job. It's packed. His community meetings, they're packed. He would bring a lot of resources. Isn't that right, Councilman?
You know it. The issue, though, is if the distinguished lady, Mr. Chairman, because we're finna pass off a lot of money at this table and allow for acceptance of these grants, if she could at least give me some causes.
Through the chair, as I stated before, the number one cause of infant mortality here in the city of Cleveland is premature birth and low birth weight. And so what combats that is prenatal care and a number of supports in terms of whether it is economic supports, things like transportation, nutrition, food, but anything that reduces toxic stress on the mother and on this pregnancy. How do we improve the family's health, the mom's health? Number one, by making sure she's connected to prenatal care and getting her physical health, getting to and from those appointments, making sure that they're happening, making sure that doctor's recommendations are taken, making sure that she is aware of her nutritional needs. We use a curriculum called Partners for a Healthy Baby out of Florida State. We've used it for a number of years. That takes mom, every visit that we have to her in her home includes an educational component. Things like smoking cessation, ridding your house of smoking. That's another cause of damage to pregnancy and damage to newborns is smoking in the home. Making sure that we're connecting with resources for additional nutritious foods, for formula if that's necessary, making sure that we are understanding safe sleep.
So, Mr. Chairman, to the distinguished lady, I appreciate that. So basically, it sounds like it's an educational situation, too. the major part of this is education, making sure that young people who are in school, do the school do a better job? Now I hear resources too, so I see you, Director. If you want to jump in, you can, to help me out here. But what we want to try to figure out, Mr. Chairman, is grabbing the bull by the horn and pulling him down to the ground. We live in probably one of the most powerful, prosperous nations on the planet. There's nowhere in the world that in the African American community we should be struck so hard and hit right between the eyeballs on this issue. And so it's one that's critical to me. And I know that education, because I had to ask some people some questions about this before I even got here to the table about it. So knowing the cause and being able to go straight to the root, and it seems like it's multiple. A lot of it seems like it's economy. So, Mr. Chairman, to the Director.
Through the chair, yeah, education, it just always seems like it's blaming the folks, and I know you're not intending to do that, and so it really is the system, and we're working hard to dismantle the system that is creating these outcomes, and so, yeah, thank you for your interest, and we'll take you up on your offer to come back in
Chairman,
April.
to the Director, I've heard that there's a lot of hospital issues too. Do we have problems with our local hospitals in the city of Cleveland as it relates to infant mortality
Through the chair,
and how they treat black women?
through the chair, I think there are two problems. One, that absolutely there are problems with the healthcare systems, that they're treating black people different than white people. The second part is the workforce. When you look at doctors at our healthcare systems, they don't look like the folks who live in Cleveland who are coming to there.
And
for
Mr.
care.
Chairman, maybe we need to bring the hospitals here at the table to talk about how they treat black women, and that's critical. And Mr. Chairman, we they get, they don't pay no taxes. And every time they come to our table, we always give them free land, free space, and everything else they can have.
It's over,
So,
Councilman.
I'm sorry, Mr. Chairman.
Yeah, I'm really
But
sorry.
I just want to put, I'm not the type of person that want to waste time. So let's bring them here at this table, and let's talk about how they treat black women, because that's part of it. And Mr. Chairman, again, we are one of the strongest, powerful nations on the planet. We shouldn't have racism, as the Director said, in the institution issue. As relates to health care in our country. And I can't even begin, Mr. Chairman, to tell you how many other issues there could be lingering here if we just grab this one
Right.
by the tail and pull it down.
We're gonna bring them in April to look at Moms First.
And I'm going to let you know, I'm not afraid of none of them. You have to speak
Right,
truth
I
to power.
agree with you, but I do want
And
to
if you
move
don't
on.
speak that truth to power, we'll be sitting here again. If they started this since 1994, I don't want to be here in 20
I agree with you.
and 30, 40, 50, 60 years talking about the same thing.
All right, thank you. Thank you, Councilman. Thank you. With that, if there's no objections, ordinance number 103, 2026 have been approved. Batter up. All right, so we're gonna do 10 minutes per person. So we did it 10 minutes. Ordinance number 322026 by Council Members Davis, Conwell, and Griffin by departmental request. It's an emergency ordinance authorizing the Director of Public Health to enter into a lease by way of concession with Neighborhood Health Care, Inc., neighborhood family practice for the public purpose of providing medical and clinical physician service at the Community Health Center at 2358 Professor Avenue for a term of 1 year. Ordinance number 32-2026 have been approved by the Public Health Director, that's you, Director of Finance, as well as the Director of Law. Director?
Thank you. Through the chair, with me to my right to answer any questions is Andrea Lyons, who's the Chief of Staff, among other titles, for Neighborhood Family Practice. And so Neighborhood Family Practice has been operating in this location at 2358 Professor for a few decades. And with this legislation, they will be permitted to stay at least for one more year as they figure out what their future holds.
Background history. Give us some background history of your building. And you have a building, is that correct? And My neighbor, it's in your neighborhood. All right. You- I want to know more about, is Councilmember Joe Jones said what I'm voting for, and I don't know where. At all. Let her do the background history first.
Yes,
Councilman,
good
then I'll yield to
morning.
you.
Good morning, Mr. Chair. So Neighborhood Family Practice is a federally qualified health center, and we have been in existence for 45 years in Cleveland. And the site that is on Professor Avenue was our second site. We've been there since close to 30 years. And so what we do as an organization is we provide primary care, behavioral health, and other integrated healthcare services to those who are navigating poverty. We, as a federally qualified health center, are governed by HRSA, and we get a grant to do that. So that site is one that, yes, is in one of your council members' wards. And so, yes, so that's who we are, that's what we do, and we're really proud of what we do in the city of Cleveland.
You want to invite me to come to it so I get a chance?
Yeah, we'll get lunch after. It'll be a good time. To the chair.
Yeah. Cool beans, man. I'll come out to see it. I might visit. I might have visited you guys, but probably forgot. Whatever the case may be, by and see, because right up the street from me, I don't just do Glenville. I'm throughout the whole, really the county,
And we'd be happy to tour you at any of our sites, Mr. Chair.
Through the chair to the assembly here. Thank you for being here. NFP has been a great neighbor for the Tremont community for 30 years. It's my understanding that there's some, envisioning of what this site might be next. And just for the council members' reference, this is a city-owned building. We own this building, and we lease this building out to NFP to provide essential community services to Tremont and the surrounding neighborhoods. My understanding also is that this Tremont site serves a majority of folks who drive in from particularly the east side, but also from across the city and region. So thank you for making us a hub. As your mission continues to evolve and you consolidate space, my understanding, I think it's Clark and Fulton is the next big investment for you guys, and thrilled to see that. We should take a tour of that one. That's the real deal.
both.
Let's do
I
both.
wanna see both, yeah.
Better lunch options and Professor, though. That's my big pitch. We'll be excited to see where we can collaborate on any future uses, but for this next 1 year period, very excited to see your folks. We're going to continue to call Tremont home.
And we're happy, through the chair, to consider that a home with this one-year extension.
You? Any questions? Because I'm coming out. Anyone want to visit the site with me?
I visited with you.
All right, cool beans. We'll grab. Francis, did you? Are you you probably already been there, right? Okay. So we're. You do?
Used to, but yeah.
Okay, so, I don't have any questions because I want to come, and I don't get into beating people up or things like that. I try to seek to understand what's going on. Any questions on ordinance number 119?
Chairman.
6? Then I'll write you down.
No question. Just wanted to briefly remark. I actually was served at my primary care provider through NFP, and really appreciated. Y'all do a wonderful job in making sure that immigrant populations are also provided and have the access that they deserve. I know that is especially true in my ward and the neighboring ward. So thank you and appreciate the work y'all do.
Through the chair, thank you for those comments, Councilman.
Councilman Jones?
Mr. Chairman, this is just for 1 year,
Yes.
Through the chair, correct.
and the city of Cleveland facilitates taking care of the actual building itself.
Through the chair, is correct.
See. And then do we have, it's just, we're not charging for this, is that correct?
Correct.
I see. So I just think that's wonderful. So the types of services that are being offered out of here, out of the building, I saw some of them. What are some of the other issues? Because I really like the fact that you're doing cancer screening. What type of cancer screening are you doing? Is it just one type or is it multiple types?
Through the chair to the Councilman Jones, we do various cancer screenings, including mammography, colorectal, and many others. And we have been recognized by third parties for leading in our outcomes on those measures, in particular for Black patients.
That's beautiful. It's really something to be able to have a system. So if I wanted to, Mr. Chairman, to the director, do we offer any of these screenings? And I know that you said there was other facilities that may be near the Lee Harvard area or in that zone. Where would we go if we wanted to get familiar type of screenings like that?
Through the chair, yeah, that's a great question. So University Hospital, Cleveland Clinic, Neon, Care Alliance, and then soon Neighborhood Family Practice is going to have their first East Side location opening up in about
We will say about within 12 months.
okay.
Okay. So right now, if a person in my neighborhood wants to go and get screening, they'd have to go to the hospital, and then or they may have Neon.
No, through the chair, the health centers that university hospitals and Cleveland Clinic operate a number of standalone health centers in the community. But I can assure you that Neighborhood Family Practice, if you had a building that would make a good future health center, that they would definitely love to meet you there at that site and see what's possible.
Well, I would love to do that.
Okay.
And so right now, the services, Mr. Chairman, are they free?
Through the chair, Neighborhood Family Practice offers a sliding fee scale for those who are underinsured or uninsured. We also accept all forms of insurance, including Medicaid, Medicare, and private insurance. Medicaid being our largest insurer for our patients.
I see. So I would love to work with you. I know that we do have Oak Street Health. I'm not, I don't know if I can compare, but maybe you could sit down and we can talk about that. I think that we have another facility that's Iron. I know we do have Neon in our border at 131st Street, but I'm not sure, what else we have over there. Are you familiar, Mr. Chairman, to the director, if we have any other agencies or organizations similar to the distinguished guests we have at the table in that area?
Through the chair, I'm a big fan of Neighborhood Family Practice, and so I think that you all should have this conversation about potential
Right,
future
but do we
locations.
have, Mr. Chairman, to the director, a location like them and near that where I can tell my folks to go to? That was the question, Mr. Chairman, to the director.
Through the chair, I think Neighborhood Family Practice is unique, and they are not yet in Ward 1.
They're not in Ward 1?
Nope.
Do we have anybody near them so I could send them, unless I have to send them to Tremont? Can I send them to Tremont?
And through the chair, I will say that our Tremont services are transitioning to Clark Fulton neighborhood. So that is happening, and we are asking for this extension so we can figure out a future use
Now,
for the space.
I will say, Mr. Chairman, to the director, the Lee Harvard area has some poor Black folks too. And we need to have services over there to help those people. And we have a lot of senior citizens who don't have services. And we have a lot of people who may not have transportation. So our neighborhoods have, unfortunately, over the years have been weakened, and our communities are not as strong as they used to be. So we also need to have those kinds of services, Mr. Chairman, to the director. So as you look to move to do something over in our area, I would love to participate with you, but I'm here to advocate for the southeast side of the city of Cleveland who do not have those type of services right now. And so if we could get that, Mr. Chairman, to the director, moving that ball down the road, I would be very interested in trying to get with you as soon as possible, because we got a number of projects, Mr. Chairman, and we would love to have you be a part of our new developments.
You're going to be with us, with Councilmember Davis and I, and that way you'll be able to advocate. Do you guys do outreach as well, like to Glenville and the other communities?
Mr. Chair, we do have community outreach, so we have folks that go out and let folks know in various communities, east and west side, that we're there and happy to serve.
And you know what I want you to do for me? We have you ever seen our newsletters?
Yes, I have.
I want to put you in a newsletter. You know Joan Mezzalene? Have you ever met her?
I can't say that I have.
So let me see. Got her to you. We'll get you in the newsletter so you can do the outreach what Councilman Joe Jones is talking about. So that way, because everyone needs it, all right? And that'll help out and when I go out there.
Thank you, Mr. Chairman.
And anything I can do to help you, especially dealing with colon cancer, I'm there 100%. You know, I have a band and we play for free. And with our band play for free for dealing with breast cancer or colon cancer, anything dealing so that when we come in, we play, we good, we pretty good.
I've seen you, and it's great.
And so when we come in, so what we do, we'll come in and instead of giving us $1,500 or $2,000, you know what we do? We say you keep the money and you put it towards your cause of dealing with colon cancer or breast cancer or ovarian cancer, and then we go and we play for free, and we come on time, we pack up, and then we're gone. We're going to have to do other gigs elsewhere, but that's our way of giving back. So I'm there, especially I am a survivor. God blessed me. I was 3B colon cancer, 3B. He blessed me to survive. And when he mentioned it, I went back and looked at it. I'm there, and it even went and affected my pancreas and everything. So he blessed me, and he in the blessing business, so I have to give back. So I'm there 100% to help when I come in, and whatever we got to do to help out with money. So that's where you at with me.
Thank
I'll give you my personal number and the whole 9 yards.
Thank you, Mr. Chair. Thank you.
I'm there 100%.
Thank you, Mr. Chairman.
All right. Any other, it kind of touched me up with that. To you, we'll be there 100%. Any other questions for ordinance number 119-20? All right, stand approved. We're moving forward. Yeah, we. Yeah, I'm just touched. I'm touched. Yeah, man, you. Yep. That was some rough time, and chemotherapy, all of that. So, ordinance number 32, 2026, stand approved, and we move forward. All right. Yeah, but when you go back and you touch other things, harsh, man, because I'm human. When you do that, it bring back memories, man.
It's the guitar players that can lose time. We can wander off on our own in the middle of a song.
That's right.
I'm just making a
You
music
got to
joke.
keep it, man. I know what you're saying. You got to keep
There you
that
go.
groove, man. You got to keep that groove. That groove is important. So Tia, she'll get you, and my doors are open. Ordinance number 119, 2026 by Councilmember Conwell and Griffin by departmental request. It's an emergency ordinance authorizing the Director of Public Health to apply for and accept a grant from Share Our Strength to conduct food access navigators program under Cultivating Cleveland Next Generation Project and authorizing one or more contracts with the East 66th Street Service, Inc., elements of internal movement, internal pool, and implement the grant. Ordinance number 119, 2026 have been approved by the Health Director, Finance Director, as well as the Director of Law. Thank you.
Through the chair, thank you. Proud to introduce to you our local food systems strategies coordinator, Zainab Pixler, who is in the Division of Health under Commissioner Francis Mills, and she's going to give some brief remarks about this piece of legislation that's an accept and spend for grant.
Thank you, Director, and thank you, Chair and Council people. Good morning. It's a pleasure to be here to introduce myself, my work, and this opportunity we're gathered here to discuss today. As the director mentioned, I'm the city's sole local food system strategies coordinator, and in this role, I work to dismantle food apartheid and promote food sovereignty. A food system encompasses how food is produced, processed, distributed, and even how waste is managed. And in my work, I collaborate across city departments to refine our policies while supporting the grassroots food justice movements led by residents throughout our neighborhoods. This involves a comprehensive approach to our local food landscape, from strengthening retail outlets like farmers markets and food cooperatives to expanding urban agriculture through our farms and gardens. At its heart, this is about working alongside residents, particularly our youth, to build a food system in which they can truly thrive. One of the programs I have the honor of supporting is Cultivating Cleveland's Next Generation, which is a youth workforce development program rooted in food justice and civic engagement. It's designed to encourage young people to lead and co-create. The Share Our Strength No Kid Hungry campaign grant will allow us to expand this mission by hiring youth food access navigators. Through the funding subawarded to 2 local grassroots organizations, we will employ 4 of these navigators. These young people will learn the intricacies of the recent changes to the SNAP program and deploy throughout the city to ensure their neighbors are connected to critical food resources, including SNAP. By empowering these youth navigators, we are doing more than just sharing information. We are ensuring that eligible residents can successfully navigate the federal nutrition programs that they deserve, led by the very generation that will sustain Cleveland's food future. Thank you for your time. I'm happy to answer any questions.
So when you work with young children, right?
Correct.
And the age is from what range?
Generally 14 to 24 to the chair.
And so working with them, you teach them skills and is that true?
So Cultivating Cleveland's Next Generation, we work with young people to not only develop skills to be in the workforce, but we also educate around food justice initiatives, around civic engagement, everything from how policy is created to implemented, to food access work at the West Side Market, to urban agriculture work across city neighborhoods.
And so the urban agriculture, do you guys implement, what do you farmers like a yard, what is that? Yeah, side lots. You take side lots and you create like what they do, how they do farming. Right, community garden.
Yeah, to the chair, we work with a couple of local farms that are already established through either the Land Bank Side Lot Program or through individual programming. The main farm that we work with is Rev Love Urban Farm in the Mount Pleasant neighborhood. Shirley Bell Wheeler manages a group of young people. She works with YOU during the summertime, and then through Cultivating Cleveland's Next Generation, employs youth year-round to both work on her farm and learn some more office-based skills.
Okay, so when you sit down, because you know, this is a great, great project. Who came up with this right here?
I did.
You did. This is good, because you know what? You could teach. And I'm looking at it right now. You could teach project management through this. For example, right? You sit down with the children and say, okay, we're going to do the implementation of this project and how. Looking at project management now. How do you do an implementation of a project? You know, the implementation could be how you bring the workers and put them in different job spots. You're going to do this, and then you'll go, and then I'm looking at the planning, because people just think you're doing gardening, but in planning, you have different roles and responsibilities. Also with the planning, you could do a resource analysis, what resources you might need to make sure this project work. Equipment, supplies, money, and then how do you monitor and control your project? And then in the end, how do you close the project out? And you could take that skill with you and use it anywhere. Use it anywhere, because it's the application of the knowledge and how to apply it. It's not just here gardening or what you're doing. As you said earlier, this is a good idea. This is real good. I really like this, because you're cultivating people. A lot of times when they leave Cleveland Public Schools or the schools, they don't the students don't know how to apply the knowledge that they just learned and how to do it in a group. Because when you do a job, you mainly, it's a project. And what roles and what responsibilities you have to, and workloads and all of that. So that project management is really good, and you have it in here. You have it in here. I would love to see it. I like this a lot.
Thank you to the chair. To clarify, Cultivating Cleveland's Next Generation was started by two women, one in Clark Fulton, Tanisha Velez, as well as Shirley Bell Wheeler in Mount Pleasant, supported by both Neighborhood Connections and Food Access Raises Everyone, as well as the city's Department of Public Health. The Food Access Navigator program was one of my ideas, meant to be a part of cultivating Cleveland's next generation, and one of our core values is ensuring youth are co-creating and leading with us rather
important.
than us just telling people what to do and expecting them to follow. We're really trying to cultivate that leadership and that program management and all of the things that you were mentioning.
That's important. Your degree is in what? What you get your degree in?
My degree is in supply chain management and food studies.
From what college you going to?
Syracuse University in New York.
Hey, man. And then it's food today. You learned some purchasing and procurement as well, didn't you? Because dealing with the supply chain.
So my experience has been particularly in food access work. So when I first moved to Cleveland, I was working for the Greater Cleveland Food Bank on their retail donation program. So some of my supply chain skills went into ensuring the food was getting to the people that needed it efficiently and quickly. And then I did work for a national nonprofit that did work with schools, mainly schools, on food purchasing. But I was more on the data analysis side, and now I'm here working on food policy and programming.
So let me ask you this one question, and I'm going to yield to my colleagues. With the SNAP cuts, because you're looking to cut SNAP this year, I don't know, what is it, 15% or 30% or what? They're looking to cut. So we look at contingency planning with your program and teaching the students how to, with these side lots that we have and open space lots, that they can do farming on the lots and whatever the case may be. Are you thinking in that direction? Because we have to think about contingency planning because they're looking to cut, which is going to hurt us.
So with the Food Access Navigators, definitely working with them to understand the intricacies of the SNAP changes, not only the cuts, but the work requirements that were implemented, ensuring that folks that are currently enrolled in SNAP or might be eligible for SNAP understand all of the requirements. They are very complex, and so working with our young people to be able to translate that to eligible folks. And then with Cultivating Cleveland's Next Generation, definitely working with young people to not only know how to access food, but to grow it themselves.
I like this. Any questions on ordinance number 119? I almost passed it earlier. I got emotional. You know, that was some rough times for me. And it made me go back and think, you know, so that was rough. So put you down, council member, and okay, council member Joe Jones.
Mr. Chairman, I'm just coming in on this. You've done a good job, so I'm kind of like moving from where you left off at. Given the fact that we have all of the crazy, out of order, extraordinary things happening on the federal level, that the likes of which I know I have never seen in my lifetime, and the negative, profound impacts of those changes hitting local cities. So I guess, Mr. Chairman, and this would be kind of like a question to the director too, is because the city of Cleveland is going to have to brace itself for these cuts and how they're going to impact their citizens. So I guess my suggestion would be knowing the numbers, you know, of those will be greatly impacted. And then even though this is it appears to be, I guess I would ask the question then, Mr. Chairman, to Director, this is the first of its type program for the city at this point?
Like it.
So that's a yes or no, Mr. Chairman?
But I know
Is this the first
time.
program for the city of Cleveland like this?
The chair, I believe so, yeah.
It is?
Yeah.
Okay. So one of the things is just listening to the presentation by the distinguished guest here is the fact that she would be training young people and that they would be responsible for at least touching 80 Cleveland families. Is that correct? How would that work? How does that look, Mr. Chairman, to the distinguished lady?
Absolutely.
Mrs. Francis Mills?
Zainab Pixler.
Zainab? I'm sorry.
Zainab Pixler.
I'm sorry.
Through the
Mrs.
chair.
Mills, please. Zainab, what's your last name?
Pixler,
Pixler?
P-I-X-L-E-R.
Okay, Mrs. Pixler.
Through the chair, so we will work with young people to plan different community events throughout the community, and then we'll also be working with existing events. Maybe that's a ward event, maybe that's an event happening at a library or a local community garden, for example. So reaching families through different events that are happening throughout the
So
city.
that's how you get the number of 80.
Correct.
So, Mr. Chairman, do we have a way where we know families that are in the city of Cleveland that we know for sure is on some of these programs and maybe potentially cut, and then we could start being a little bit more targeted if these cuts take place, Mr. Chairman, to the director?
Sir?
Through the chair, absolutely, there would be an opportunity to.
I'm going to ask the question again, Mr. Chairman, to the director. Do we have people who we know that are on these programs, a listing of them, so that if we don't have that listing, then we may need to look into it, where we could reach them if these cuts start to happening all across the city of Cleveland. And the reason why I'm asking, Mr. Chairman, to the director, the reason why this is so important while we're sitting here at this table, is when people get hungry. Say it one more time. When people start to have an issue where they can't eat food on a consistent basis, things can get really nasty. I'm concerned. So again, I would hope that this is on the radar screen and we have some preventive measures in place. And we also talk about maybe potentially feeding some of our younger people. Because when I was growing up, back in the day, black people, poor neighborhoods, when Reagan was the president of the United States of America, we had cheese lines and bologna and farina. I don't know if any of you are old enough to remember that. And we used to make some good macaroni. Some of those who are African American who, like me, realized those days when we had plenty of cheese for macaroni. And so what I'm sharing with you is that we're faced now with a president that cares nothing about our communities. We can see it on his Truth Social when he took Barack Obama and Michelle Obama and made them like monkeys. So I'm really concerned, Mr. Chairman, when I talk about these issues here at the table, so I would appreciate it because I'm paying attention. I would hope that everyone's paying attention. And so the program that this distinguished lady, Mrs. Pickler, is bringing could be something that could be a saving program for our citizens, or we can utilize its model to be able to talk about targeting certain families and communities that need help. So when I was growing up, we had those schools that were open up in the summertime and give us free lunch programs. So do we have any of that, Mr. Chairman, to the director? Are we even looking at thinking about how we're going to deal or tackle with this issue?
Through the chair, we've stood up a task force with the county to look into what are going to be the impacts and what are we going to be able to do about it when the state and the federal government make these cuts. Right now, we don't have the exact rules and regulations from the state for how they're going to be enforcing these new requirements, and so we're just getting prepared. And Zainab Pixler's program with the collaborators that she mentioned is one bright spot here, and we're looking for many more bright spots so we can support our local food systems in Cleveland.
Mr. Chairman, I'm putting this in your box because you're the health man and you're responsible as the chairman. I'm very concerned about how these cuts will potentially happen, if they happen, but I don't trust this president nor his administration to do what's right on the behalf of poor people and people in general who are in need. So it's my hope, Mr. Chairman, that on this side of the table we begin the proposition of at least put together a preliminary process or a thought, get prepared so we're not caught off guard. And Mr. Chairman, to the distinguished lady, I think that, you know, the program that you have is a great model. I see a whole lot of possibilities here and on a different level of thought. And as we move forward in the future, I'd share some of those ideals and concepts that would enhance this program and make it something that will be a very profound and powerful impact in changing people's lives. Because when people get hungry, they need to know that there's something there that can help them. Thank you, Mr. Chairman.
And thank you, Councilmember. I'm going to say this real, and I'll be real quick. I love your program, the way you just narrated it. And you have different, let's say, different parts that you're going to work on. Are you going to teach them how to do overlapping projects at the same time? Because you could work on the gardening and you could work on other that you just narrated to me at the same time. And that way you can teach them how to cross-train themselves. And I'm excited about that.
Absolutely. To the chair, this funding will support specifically the Food Access Navigator program. Our goal is to retain at least 2 of the Food Access Navigators year-round, and in that they will be working on everything from urban agriculture to, like I mentioned, the food access work at the West Side Market. There's also some mapping projects going on, so they're learning how to use Google Maps.
Actually about mapping.
Yes.
Yeah,
So, yes, they definitely work on a variety of projects under Cultivating Cleveland's Next Generation.
You could use Project Management 2020 or 216. You know, they have some good resources in there. Put it on Excel, and then, you know, it would tell you when they, you know, meeting their goals and objectives. You can monitor it better, and that way you could do the overlapping projects with your project. You know, it's a good piece. I like it. I like it a lot. Let me not talk for a long time. I yield to Councilmember Harsh, and then Councilmember. Sir?
Thank you, Mr. Chair. I'll be very brief. It's always an easy ask when the administration comes to the table requesting permission to accept other people's money. You got me, okay? I'm with you. But since this is a small dollar amount, $24,000, I believe, and since it's 100% being passed through, can I ask what the need for the city's involvement is? Why, through the chair, the organizations didn't just apply directly to the funder to just take the money? Or what's the role of the city here?
Through the chair, the Share Our Strength No Kid Hungry grant was exclusively available to local municipalities.
Makes perfect sense. Thank you, Mr. Chair. Appreciate it.
Member?
Good morning. Appreciate everyone's time again, as always. I just wanted to give a quick shout out to the chair, to coordinators newsletter, Farm to Inbox, and if others are interested in more information about how our food systems work in Cleveland, there's been a lot of research that's been done, and it's a really convenient way to help out. And wanted to give a quick shout out to one of the larger urban farms that's in Ward 12, Bay Branch Farm, that I know Ms. Pixler has worked with as well. So really appreciate the program. Looking forward to understanding more of how we can increase this type of work and how we can collaborate on that. Thank you for your time.
Thank you very, very much. Any other questions on ordinance number 119, 2026? Stands approved. Council member, just stick around, then we'll come back and we'll discuss the lead piece. And
To the chair, just one comment. This has been our first opportunity to get to the table to talk about food systems. We've been wanting to, based on the schedule, get here to introduce Zainab to you. This small program is just one of a whole host of things that we're hoping to do across the city. So I'm hoping that we'll have an opportunity to come back so she can give you a fuller view of food systems work in the city of Cleveland and how we would hope at the health department to improve our residents' opportunity for better food access. So we
okay,
we
great,
would
great,
appreciate
great.
that.
You know, Commissioner, we could do that. You'll get with Tina, and she'll tell me, and then we'll put it together. You know what I want to do also, because Austin Davis and Councilmember Austin Davis and your director, we're going to get together to discuss the environment. And this right here helps us with the environment as well. But gardening doesn't always have to be vegetables. It could be other kind of vegetation also, because we have to be able to, in cities, how to, when we deal with air quality, how to put vegetation and have us working together for the good of the whole, for the air quality for the residents.
So
We might could do a
appreciate it.
sidebar with that, because I know we're going to come up with the environment. I think in late March or early April, we'll discuss those things. Have you guys met yet? Okay, a couple of times. Okay, good, because that's important. But this can fall into that paradigm, because vegetation is important.
Mr. Chairman, I think the director, Mrs. Mills, is right on point. I'd love to see her presentation to see how we can expand it, and then and how powerfully impacting it will be for the overall city of Cleveland. So thank you, Ms. Mills.
Yeah, you guys are going to meet with Tina. So I want to do for about 8 to 10 minutes, just do something off base a little bit. Cal Early, he's going to introduce their program, and I want you guys to know about it, and then we'll yield to the arts. So but we're not going to ask any questions about it, but he's going to come back. 119-2026 is approved for the record. Thank you. Keep me on task. How you doing, young lady? How you doing? When you narrate it, we will bring you back, Cal. But did you bring any handouts to give to my colleagues? Sir? And then I got to bring Assembly of the Arts. You can narrate it. You're on TV, you'll be able to pull it off for TV. Out with the cost. And you guys know, everybody know this brother right here, right? Introduce your staff. Yeah.
All right. Well, first of all, good morning, and thank you to Councilman Conwell for the invite. I'm Pastor Kyle Early. I serve as the senior pastor at City of God in the Collinwood community. I also am the CEO of It's Not a Moment, It's a Movement. We have brought some of our staff and our partners with us today, and if I could just allow them just a moment to introduce themselves and say what they do for the organization and how they're partnered with us, then I'll do a brief overview of what we're doing here as a program to help the city of Cleveland, and I'll start right here to my right.
Good morning. Good morning. Good morning. Thank you so much for having us. I am Angel Jacobs. I am the Director of Operations for It's Not a Moment, It's a Movement, and I oversee the operations of the Sustaining Family Initiative, which we will be here to talk about today. Thank you, Council. It is Angel Jacobs.
Yes, my name is Calvin Reed. I am the housing coordinator. We empower our young women to be positive, good tenants, and we also support and help them financially to prevent evictions, help them with down payment and any other moving expenses that they might incur.
Hello, my name is Davie Moore, and I am a State of Ohio Board Certified Doula. And I am with the Education Department.
I'm Jacqueline Bradshaw. I'm with the Village of Healing. So we are partners with It's Not a Moment, It's a Movement, and we will be providing the clinic, the infant mortality, which you talk about, that's what we do, and to work with their women with social deterrence of health.
This is part of our team and partners.
Good chance.
Throw me under the bus.
This one right here works for you too.
Oh, okay, I wasn't pushing it hard enough. My name is Camelia Dabney. I am a real estate agent, but I am teaching financial literacy through budgeting, credit, repair.
You know what? Didn't I work with you before somewhere? Yeah, I was over there, and then with the fatherhood group, me and Lavelle Custard. Yeah. I'm not going to talk long, but I'll yield you.
So this is some of our staff and partners with It's Not a Moment, It's a Movement, which I'll give you a brief overview, was established in 2018. And our focus has been, when we first started, education and after-school programming, particularly here in Cleveland, but also in the Akron area. One of our highlights of our success was our youth empowerment program was able to establish a sports program in Akron Public Schools that was for sixth grade boys. They did not have any sports programs. We established a basketball league and an incentive-based program that led to not only all of our participants having a 2.5 GPA or better, but also attendance and improvement in attendance and behavior within the school. That program then went on to 6th and 5th grade boys and girls, and we were able to service over 1,500 students between 2015 to 2021, right after COVID. That program also, we were able to do violence intervention programming, where we got $100,000 from the city of Akron to do ambassadors, to train them as mental health ambassadors and violence intervention ambassadors. Each participant also had wraparound services and earned $1,500 for being in the program, and are now currently ambassadors within their school district. And we host summer programs here in the city of Cleveland as well. Other area of focus is faith and mental health. We're funded through the Adams Board of Cuyahoga County, where we do faith and mental health training for churches across Cuyahoga County, and also behavioral health specialists. We have been able to train over 100 churches throughout Cuyahoga County, and we've been able to provide wraparound services, referral services, and resources in the area of mental health for senior pastors, as well as their congregations, being able to help them navigate to getting resources for therapy and counseling. We also provide money for those families as well if they do not have insurance, and pastors if they do not have insurance to get free mental health services. Our baby that we're here to talk about today at the table is our Sustaining Families Initiative. It is similar to what you just heard from the presentations with Moms First.
No, it is.
It really is. I was sitting back and I was like, wow, we're doing the same work, which I'm very happy about, which means that we're just an extension of an investment that you've already made.
Have you ever worked with them before?
We have not. But you want
to partner with them?
After learning about what they're doing today, we definitely should come to the table and collaborate and see how we can engage more with them. Our Sustaining Families Initiative was funded first in 2024 from the Office of Faith-Based Initiatives. We received a grant for $175,000 to help expecting mothers and fathers that were TANF eligible to be able to navigate their expecting mom's journey. Through that program, we offer free certification programs where if an individual wants to become certified, let's say in STNA or dental assistance, we pay for them to go through those classes, and we also pay for their testing to become certified. We provide wraparound services for each expecting mother in the area of housing assistance, which Calvin Reed will be helping with, maternal health and therapy and counseling sessions, which we're partnered with Village of Healing and Minority Behavioral Health Group, and other organizations that are at the table and are not at the table to help ensure that that mother has the wraparound services and support that she will need as a family to be able to birth a successful baby and that baby live. So what we've been able to do through the success of that is certify over 30 participants in the workforce development, not just the certification, but also helping them find employment. Not only that, we have provided assistance to stop evictions. As you know, that it can be tough on a single mother, on a family when they are expecting children. The economy is pretty bad, and looking for jobs can be tough. And so what we've been able to do, and Angel Jacobs, our operations person, put together a great format to work with landlords to stop evictions. They signed MOUs where they did not put those families out, and we provided the rent assistance to help them stay in, but also, again, helping them find employment and other wraparound services that they may need. We were blessed, and we did a phenomenal job with that program. And then I applied for another grant through the Ohio Department of Children and Families, and we were awarded $550,000 to continue the work that we are doing right now. So in a total, over the next 3 years, we will have invested $750,000 into Cuyahoga County, particularly Cleveland residents, to help expecting mothers through their journey of birthing beautiful babies. I wanted to also provide a little bit of time not only if you all do want to ask questions, but for Angel to talk about the staffing piece of this in terms of how many people we have on our team, exactly what they are doing and the areas that they are focused on. And then I'll close by saying, I'll close with what we would need from the city of Cleveland to make this successful. Again, we're not here to ask for any resources, as you just said. It's also always a beautiful thing when resources come to the table for our residents and for our city, and so we are providing those resources. So at this time, I'm going to ask Angel to quickly talk about right now? Okay. I'll have Angel talk real quick about the staffing and the program as well.
Thank you, Angel.
Thank you so much. Appreciate it. So our Sustaining Families Initiative, we have a dedicated staff that is focused to this initiative only. I know that Pastor Kyle spoke about a couple of other initiatives that we have, but this one here for our expecting mothers, and I do also want to add that it is also for new mothers, mothers nurturing children that are 1 year and younger. That is part of our program as well. We have 2 dedicated case managers who are able to speak with the mothers in forms of intake, referral, case management, but what's really special is that they also have the ability to conversate with the case managers that they may have in other locations, in other spaces or organizations that they have. We also have put together a systematic way that our intake works so that it is efficient. So we have a dedicated housing coordinator that is to the right of me, Mr. Calvin Reed, who will only be focused on the housing piece, not to overwhelm the case managers with the caseloads. They are going to go in and initially do that intake, make sure that that assessment is right, gauge what that family's needs are, and then be able to dissect that into the areas of other expertise. We have a workforce coordinator who is not here with us today. Her name is Valencia, and Valencia will be specialized in just the workforce. What we do know is that how you can support anyone but our families is that they have to be able to sustain themselves by being able to provide an income for themselves and their families. Our workforce readiness program allows mothers to do that because we have an initial streamline into certification programs that they can then take and gain gainful employment almost immediately. We pay for the actual classes. We partner with community partners, First Hand Health Careers, Tri-C for those programs, but we also pay for all of the things that come with it, because it's wonderful to send someone to class, but then they need uniforms, they need supplies, they need books, and then they also need someone to pay for the actual certification for the state. And so when we're able to provide that, then now they're able now to go home and provide for their families. That immediately impacts. The housing piece is critical. Last year, we had over 30 participants that we were able to successfully avoid eviction, and that's critical because if you are worried about where you and your family is sleeping and if you are safe at night, we cannot ask you to go be great. When you are worried about your Maslow hierarchical needs, we cannot ask you to go be great if you are hungry, if you feel unsafe, if you are mentally unwell. So our partnership with our community partners provides us a Power Ranger attack on that thing. We do what we do well, which is execute programming, and we ask our community partners to help us sustain that because the goal of our program is not just sustainability, but access for our moms. They oftentimes have no idea what resources are out there for them. They oftentimes do not have support, family, friends. What we offer in our cohort, because we do this now in a cohort-driven model where we have 25 moms per cohort, and that will also give them the community and social support that they also need. Because one thing we do know is that when you can't advocate for yourself, things begin to fall apart and then those dominoes begin to fall. So that is why the cohort-driven model is so critically important. We have actively today 31 mothers that have completed assessments, and we have an additional 20 mothers who have completed the interest intake, which means we'll convert them over to assessments, and our case managers will begin to begin to have the process evolve for them. And then they will have the access to workforce, to housing, to food, right? We want to make sure that we are attacking those social determinants. Those people are hungry. We want to make sure that we partner with our community partners. The food bank is one as well. We partner with them to allow them access to that CRC as well, but we hand walk them through that process. It is one thing to tell people about all these beautiful things that are happening, but then not give them the backbone support to be able to navigate the process. Open for any questions.
Questions here?
He has a question.
Thank you, Mr. Chairman. I'm actually impressed because I didn't know what to expect, and so I'm still kind of like consuming the information. So I would certainly yield to you, Mr. Chairman, to let the total presentation happen, and then after, then I may have questions.
Fantastic.
Thank you.
I'll just say this presentation is often speaking for itself. You're doing tremendous work, so thank you very much. Are there other presenters in the lineup here?
Was that it?
No, that was it, yeah.
Okay, great.
I will close by saying this, that I do want you all to know, I don't know if Angel hit this, we will be servicing over 150 families between this year and next year with these resources that we have, and we are currently looking for some more resources to keep the program going. Sustainability is going to be important, as we didn't just want to be a hot spot just to stop at, and for a couple of years, we really want to keep this going. So the ask for City Council is that if you all can help share this information in your newsletters to get it out in the community, to help more resources and referrals come through, that would be great. Let your constituents know about the program. If you have community meetings or events that are coming up, you can reach out to us and we can come out with a table to also share this information with your residents as well. And then just your support. If you see us out doing the work, please come out and support us. All of our information is in here, so you can participate in any of the events that we have coming up, and we look forward to helping the city of Cleveland move forward. Thank you for your time.
I do have questions if that was the end of the presentation. I thought it was going to be more. I see so many distinguished people here, so I thought, Mr. Chairman, we were going to go straight on down, but Mrs. Jacobs really covered a lot in her presentation. I guess the question here, I'm looking at the booklet, and it talks about the various different, I would presume these are your partners, your key partners. And do you have any key partners near to or located near the Lee Harbor community?
Councilman, although we're a partner, the Village of Healing has opened a second location in the Buckeye Shaker location. So Lee Harvard is hop, skip, and a jump. So those women can come to the Village of Healing. They will get the medical services that they need. We'll help them with the social terms of health. And then we make sure that they get connected with.
And Councilman, I would also like to add to, in terms of proximity for your ward, our workshop, our educational piece, our educational track, those pieces are also virtual as well, right? So if your community would like to join those, they're absolutely free. The maternal health and wellness classes, their parenting and infant care classes, financial literacy classes, those things are also available to your community as well in your ward.
Well, I just want to say I think you guys are doing a wonderful, beautiful, fantastic job in serving the neighborhoods, and certainly would love to have you in my newsletter. Have you write some articles, services that can be provided in addition to coming to some of our community forums where you can let people know about the various different services that are available. And it's just really outstanding to see your group here. And then I guess I would presume, since you've made the presentation to us in an educational way, at some point would you be looking to work, to help us in our neighborhoods with, I'm not sure how, I see the chairman over there. I'm not sure how we're going to work it out, but we would love to see something like this. As you may have heard in the earlier presentations, we don't have those kinds of services in the Lee Harvard like we would like to see them. And our community, even though it's been a strong neighborhood for quite some time, it's still a neighborhood that's hurting and has a lot of poor people. And in some of our areas, unfortunately, it's heartbreaking what has happened to it over time. So we have a lot of people who need help in the Lee Harvard area. I don't want people to get in their minds that Lee Harvard is this this light up on the hill. We have a lot of people who are in need and need assistance and help, and I would love to work with your group to be able to do that. And Kyle, you know, you Dr. Reverend Kyle. Don't want to get because I don't want to say the title's wrong, then people get upset and say he didn't give them the proper respect. So I appreciate all the hard work you've done to put the agency and organization together. And then, you know, you're like a son of Ward 1. So we would love to have you come back and share some of the growth and the experience that you have with helping people. And to the chairman, thank you for allowing me the opportunity. I don't have any really questions to shoot at you, just other than how do we partner and how do we work together.
Well, that's pretty easy. All it is a phone call, Councilman. You know, I'm going to always show up. And to every other council person that's here, again, our information is in the packet. If you reach out, we will show up. We can come to your ward club meetings. We can come to your community meetings and share this information. And we have to spend this money, so call us quickly, please, all right? Call us quickly so we can give these resources out to the families that really need them. And again, thank you for your time. I really appreciate it.
Thank you all so much for being here.
And we'll bring
It's not a question.
presentation on the council floor.
Councilwoman Jones.
Impromptu, because
Yeah, I was just going to note Village of Healing. I just want to give a shout out to them for providing quality health care. I just changed my health. They are now my new health care provider. And so due to losing my long-term health care professional, and I will just say, hands down, I was treated just wonderfully, and I appreciate it. And I really would encourage people who need quality care, go to where you are wanted, appreciated, and loved on. We'll be having the first, actually, we are the Cleveland Commission on Black Women and Girls will actually be having our meeting there at Village of Healing in the Buckeye Shaker neighborhood this upcoming Thursday at 5:30 p.m. So we are in partnership with them.
okay, thank you very much. And we're going to bring them down within 2 weeks to on the floor of Cleveland City Council. And Pastor Early is working with Imani, and we'll get that moving. All right, thank you. See you guys later. God bless. I want to bring up the Assembly for the Arts, so we can, and it's going to be real quick. And I'm going to Rhonda. You coming up, Director?
No, I'm just here to support.
Okay, great. You know, I love doing the arts, man. That touched me up with the band playing for those cancer events. And, you know, tomorrow I got to go get checked up because I go every year. But when the doctors say be there at 11 a.m., you know what time I'm there for my checkup? Yep, you right, 10 a.m.
Right.
I don't play around with that, and that kind of touched me, man. It's a really scary thing because, you know, here's the thing about diseases and cancer. You think about the family. It's family and friends. You look around at them, and you're like, wow, man, you think about that. That's just where I'm at. So, Director.
To the chair, and to the council members, thank you all for having us. Today we want to provide a brief overview of what Assembly for the Arts is doing, what we've done, and where we are heading to support the great city of Cleveland. But I do want my colleagues to introduce themselves. We are a small but a very mighty team.
Good morning. I'm Deidre McPherson. I'm Chief Community Officer at Assembly for the Arts.
Good morning, Chinanya Nkemra, and I am the board chair for the Assembly for the Arts.
To the chair, yeah. I've got a short presentation. We can follow along on the slides, but and happy to take Q&A at the end. First, I really just want to the slide 2, talk about who is the creative economy here that we're talking about. To the chair, thank you. I got it now, thank you. There are really 3 categories that we talk about when we talk about this big creative economy. One is artists, individual artists. They're in all of your wards, and we're serving all of those wards. Second, they are arts organizations that are serving all of your wards. And thirdly, they're creative businesses. They're in quite a few of your wards. So we're not just nonprofits, but we're the 3, individual artists, creative businesses, and nonprofits. A little bit of a history lesson. Don't want to bore you, but Assembly was created 5 years ago. Y'all, some of you remember me coming before the city council and the county council to seek support for some really emergencies that were happening. COVID era funding, and thank you to the council and to the new council board members on board. The city, with our advocacy, put in $3 million in COVID era funding. This past year, those dollars hit the ground and created 7 wonderful projects. We also work with the county and advocated with the county for an additional 3.5, so a total is 6.5. So we are an advocacy organization, in other words. We help to cultivate all the arts and creativity, and a big lever 5 years ago was making sure those COVID era dollars affected and supported arts and culture, which had to stop. Secondly, you'll recall that last year, or in 2024, we advocated for Issue 55. I want to say thank you to this table, to the council, and many others. What is Issue 55? This was a levy that is supporting, once it passed, because the current levy was ending, once it passed, it is now generating, it will generate $138 million over the next 10 years for some 300 nonprofits. We've heard about the instability happening in federal government with cutbacks. We heard that in the previous 2 sessions. But here in the county, thanks to voter support of 72% and advocacy that's coming from Assembly for the Arts and our public partners, we have locked down and we have safeguarded stability for arts and culture organizations, even in the midst of the instability. So we try to go for the biggest bang for the buck. 300 nonprofits. If you name your favorite arts and cultural organization, I bet they'll be on that list. But that levy is going to end in 2035. So think of us also as a think tank and a research tank. We will be coming back to you, and we are working now with researchers what's going to succeed this cigarette levy. Your health director was here earlier. We really don't want people smoking, do we? Are there other things we can do in this area, in this city, in this region? We're looking at dozens of other cities and regions across the country. We are working with researchers to figure that out now, so we'll be ready when the time comes. We don't want to wait till the last minute. This brings me to the last big umbrella thing. Great cities have cultural plans that drive, so we're ready for crises. We're ready to work with other plans. Many of you are looking at plans in your own district, arts plans, cultural plans. We have the shore to quarter shore work that's happening. We have work happening on the west side of Cleveland, work on the east side. So we want to be ready, with the support of philanthropy, to lay out a plan that stands alongside of those. We've heard talk today the importance of the southeast side of Cleveland. How does a cultural plan lift up artists, creatives, and jobs in all of those neighborhoods? There's work happening, some of it's disparate. It needs to be woven together. We know it's happening with our CDCs, how are we connected to them? We're just at the beginning of this stage, but you will see this happening. We hope to have this cultural plan working with the city, the county, and others, pushing out in 2027 and even into 2028. I mentioned that we are researchers. We work with the biggest researchers across the country, so we have the data that you would have to advocate for the city of Cleveland and your wards. I'm going to mention just a couple of these, not all of them. Creative Ohio, they are our Columbus data organization. SMU Data Arts, we're doing a lot of work with them on national research, comparing Cleveland to other cities. And I'm going to mention the NEVA, National Independent Venue Associations. So, if you want to know the numbers, some of us are economic data people. Yes, the arts are a business. We drive $7.59 billion and support 26,000 jobs. Happy to share more of that with you in detail. Within nonprofits, we have some new information that's come out of SMU Data Arts, who we're working with. And there's some good news. I know there's a lot of bad news. Cuyahoga County, Greater Cleveland, is really strong in the arts. Even economically, we're showing strong post-pandemic growth. Believe it or not, revenues and operating surpluses are outpacing national averages. We have the raw data to back that up. Organizations that are expanding in their expenses and staffing since 2021. Now, let me add a little caveat. There's a term we use, lived experience. Is this the lived experience of all of our arts organizations? No. We are really fortunate that we have a number of outsized, large organizations. They do drive a lot of these positive statistics, and we're getting more statistics and more research that will narrow down on not just the largest that are driving this, but stay tuned for that. Another asterisk that's not as positive, audience attendance remains relatively low, even though we're having more programs among all these groups. We're trying to figure out why that is. We'll figure that out. And the last bullet, local government funding is lagging our national average partners. Cleveland is on a number of lists. In the last two, your last two presenters, we hear about the challenges in health and human services, infant mortality. We don't want to be on the last on the list when it comes to arts investment at all levels. So we want to be a partner with the city when it comes to how we are investing in the creative economy. And that brings me to, again, this is more data. The blue chart shows how the expenses of our artists has gone up. It went down during the pandemic and came way back up, and it exceeded the national average. That's the red line. So Cleveland is hitting way above its weight, and that's not just Jeremy Johnson saying that. These are our national researchers that are looking at hundreds of cities across the United States. I mentioned that we're not just about nonprofits, but we're also about for-profits, and thankfully we have partners that we can lean on. We don't have to do everything. One group that is doing a lot of work is a group called NEVA, the National Independent Venue Association. They are the group that represents some of our city establishments, such as Beachland Ballroom or the Happy Dog, live venues, the nightlife. They did a study you might have seen that showed that they're losing money. Even though they're for-profit, 1 out of 4 is losing money statewide. Those numbers even, or 3 out of 4 losing money statewide.Ose numbers are even more hitting home here in Cleveland. So we're working with them alongside of them to promote this so there can be different policies, whether that's in Columbus or here locally. And I'm about to wind down. Individual artists. We are really thrilled that we have the support of Cuyahoga Arts and Culture to extend individual artist grants across the county, and that includes the city of Cleveland. Just this past year alone, there were some 72 artists and creatives from every single ward in this city who received grants or awards ranging from $1,500 up to $10,000. Some were randomly selected grants, some were jury grants. There was one artist, she had a fire in her house. It burned all of her equipment up. She was unable to care for her newborns. Because she received one of these boost grants, is what we called it, she was able to buy equipment. So she's now back in business, making wonderful toys and knitted features for new moms. You can see here just a look at which wards, and every ward has some level of artists that are benefiting. We're going to do this again this coming year, not with the city's support yet. We're doing this with county support. We'd love to be able to match that. I shouldn't say the county support, with Cuyahoga Arts and Culture support. They have the county in their name, but they are a state, it's complicated. They are a state subdivision, but they focus just on county. And I'm sure that my counterpart, Jill Paulson, would be happy to share more information. So we also work with educating artists and entrepreneurs in the area. We have a partnership with COSI, which is a part of Greater Cleveland Partnership. And these entrepreneurs, artists are also from across the region and from across the city. You know that we're located in the Midtown Collaboration Center. Thank you, Councilwoman Stephanie House-Jones, for being the locus for this. It's a place where we collaborate. We do a lot of collaboration with other nonprofits. We'd love to collaborate with the folks that were here at the table who are working on health, who are working on education. We've brought folks into the city. We keep talking about how do we hold on. We've literally brought nonprofits to be our co-tenants in our space. So we're bringing jobs to the city, though they're paying dollars. Cleveland Arts Prize, Cleveland Arts Education Consortium, Chamberfest Cleveland. So we are bringing folks into the city to work alongside us. Even though we're not huge, there are things that can be done even with smaller nonprofits. I would be remiss if I didn't mention the work we did directly with the city on the Transformative Arts Fund, led by Rhonda K. Brown, who's here. That project, 7 projects that generated jobs and workforce for 300 some artists ultimately, and 400, 500 other businesses. I'm sure she will share the details of that, and as she has. We were the fiscal agent for that. What does that mean? We were the people that helped to get the dollars to pay those creatives and pay those institutions in a timely fashion. So we know city has bureaucratic levels, and sometimes that doesn't work well for creatives who are on shorter timelines. They don't have the ability to float those dollars, but we were able to get those dollars out the door. We want to thank the city and the city council and administration for entrusting us to manage those $3 million. Something new has come aboard, and I want to thank Rhonda Brown for sharing this with me. This is under the city's leadership, Asphalt Art. I'm sorry, through the chair to Councilwoman.
Ms. Brown actually sent it to every council member last week. So
across the nation and to the chair, across the nation and the country, this is not just about art. There was a study done by Bloomberg that showed that in certain areas where asphalt art was created, they reduced pedestrian fatalities by up to 15% because of asphalt art. This is not just an arts program. It's a public safety program. We're thrilled to partner with the city. I think the RFQ is going out. We will help get the word out for artists to submit proposals to the city. So we are a partner. And I would also be remiss if I didn't mention the instrument drive that we've done with the chair's leadership called Play It Forward Cleveland, with a number of nonprofits to get instruments in the hands of children across the city. So just to back up and close out, our priorities going forward are long-range stability for the sector. This is not just what's happening today and tomorrow, but how are we creating an array of supports? Could it be a cigarette tax? Could it be something in addition to that? But where will we be in 5 or 10 years? That's going to mean policy with the city of Cleveland, with the county, perhaps regionally. Secondly, getting the creative plan passed or created. That's going to be very important, and standing along other plans. Thirdly, partnering with others who are doing this work. We do not do this work alone, such as Cuyahoga Live. That's the live music work. And finally, continuing artist funding programs. We do that with Cuyahoga Arts and Culture now, but we'd love to do more. We have proposals to look at certain neighborhoods of Cleveland right now where we could invest more in creatives. So there's more work to be done. We're thrilled to be partnering with the city. And I open it for questions and answers to myself or Deirdre McPherson or to Chinenye and Kimura.
House Jones, then you, probably know already that we champion to bring money into music school settlement,
Yes.
$3 million, which is really good. Body every year to the tune of 100,000 or $250,000. Children to music camp at Julio de Burgos, Music School Settlement, Rainey Institute of Music,
Right.
and what was the other third one? Burgos, Rainey Institute.
Center for Arts Inspired Learning, Chair?
Hey, you got it. Don't tell them I forgot to mention the name. Center for Art, so the children could go and study music, and it keeps them off of the streets and build character, which is very, very important. And we also raise instruments, new and gently used instruments, so that we can give the instruments free of charge to children when they finish their programs, so they can continue to keep playing, which is really, really cool beans. I want to thank you guys for helping to champion that movement for the children. We got to do it again this year. With that, Councilwoman House Jones.
Thank you through the team, through the chair to the team. Thank you all so much for the work that you all do. There were just a couple of things. I want to start, I guess, from my last point in question, when you talked about how we used ARPA dollars to directly fund artists, which was not a reimbursement. We actually invested prior to, and how we have been able to show with processes how we can be responsible stewards of the people's money, but meeting people where they are. Can you talk about that, of what that looked like, and how it unfolded when we actually invest in people from the beginning and not expect people to reimburse resources that they don't have?
To the chair, to the councilwoman, yeah, that was a very important distinction in this program versus other programs. We had quite a bit of dialogue with the administration. We were accustomed to doing this, but city halls are not always accustomed to that. So I can't speak to how the city did come to adjust their requirements, but it was critical to making it a success. And I'm sure the administration can speak to that. But we probably would not have been able to do it, or would not have been enthusiastic about entering it unless we knew we could get those dollars to people where they are, from the councilman to the councilwoman. It's a national model to make sure that that happens for folks who, where they are. They don't have the luxury of waiting the 6 months or sometimes longer for funds while they are doing the expenses. These are small businesses. These are individual artists.
Yeah, and through the chair to the team here, I really want to highlight this. I know you highlighted one of the transformative arts projects for those who call a place home within Asiatown. And again, real dollars getting to real people. Many times our city, I believe many times we operate from a deficit mindset, always thinking that people are going to do something wrong, things are going to go bad. And this is a prime example of showing when quality meets quality, you get quality results. And so I would really encourage my colleagues here for us to begin to implement processes where we can treat our people like the professionals they are, and great things can happen and go from there. And this is just another demonstration of what we can do when we consistently get the hear back of, we can't do that. We have to be good stewards of the people's money. And this is a demonstration that we can do that. So I wanted to thank you from there. And then there were, early in your presentation, through the chair to the team here, that showed some of the numbers about the lacking of audience participation in many of our artist venue. I will say probably it's just the economics. When you don't have disposable income or disposable time, you really make decisions on where you can go and patronize. Similarly, when it talks about the lagging of local investments, I definitely would want to get a little bit more into that comparatively to other cities. But one thing I think our body needs to do is really analyze just overall, I would say, at least in the last generation or two, the real tax shifting of how taxes are actually spent or not spent from the federal, state, and local government. We were in a conversation last week with CMSD, and they talked about the percentage that the federal government, state government, had been investing in our schools. And when I had did some of the initial work, there is a study I think I was able to at least capture back from 2021 and 2001, excuse me, how the state had been putting in at minimum 50% of our school phones. Now in 2026, that rate is down to, I think it was 35%. So, and now the local government has having to increase more, or our local community has had to increase our percentage that went just to schools. And I'm saying similarly, the press on local communities are so real in a variety of different ways due to the changing or elimination of taxes in other areas. When you look at the capital gains tax, things of this nature, I am not a tax guru, but I'm just saying these things are really important. And we as a city need to be much more aware of that and thinking through a real strategy, because at this point, I really just think that cities within the state of Ohio will absolutely need to come up with a ballot initiative, similarly as they are doing a ballot initiative to potentially eliminate property taxes. We will have to do something similar to get the resources from the places that we know, like capital gains tax. Like we have to attack these other partners. And I know people will be like, we can't do that. Yes, we can. And people have been doing it, because more and more the people who have the means are hoarding their resources while the rest of us have to fight over resources. So I'm just bringing this to this light because you showed it, but I think it needs to be given into context about what has happened over the years when it comes to our tax basis, because we know people are tapped out with the property taxes. And so when people can start to look at, well, how have we been paying for some of these things prior to, and how were local governments able to diversify their funds, it was because we had a radically different tax base and strategy of the money that was coming into communities, which now is literally slowly been eroded year after year. And Cleveland City Council absolutely needs to be able to bring forth real solutions to our people, to educate them so that they can come along with us and hold people more accountable and responsible for paying their fair share, because that's not happening. That was no question. It was just more of a statement. But I wanted to bring the context because it was put up there. Thank you.
To the chair, well taken. Thank you.
That was excellent. Yeah, any further comments on this? Happy to move on as well. Well, then I think I'm up next. Austin Davis, I'm the new council member from Ward 7. Great to meet you all. And on behalf of the disproportionately successful artists from Ward 7, we won the most number of individual awards from you last year. So thank you very much.
To the chair, to the councilman, my council person, by the way.
Oh, great.
Parts of our city really show forth their creativity, and certainly we're pleased that there were so many applications. But we want applications from all parts of our city. Like I said, every ward is represented, so and we want to get more applications from all. And congratulations on so many from your ward.
Well, the creative economy is very present in our community, as you know. I mean, like the Transformer Station or the public art that you see around town. It's great. And shouting out to our, Rhonda, who has been a key part of making the art so prevalent in our city. It's wonderful. I was going to ask about, just really in a similar vein as my colleague Stephanie House-Jones, if the local government here is spending less than half of a peer city average of 3% to 7% of arts funding comes from local government. I always assumed it was partly because we have such a robust nonprofit and philanthropic sector here locally as well. There may be more resources from those other sources. Can you speak to it? Is that instinct accurate?
Through the chair to the councilman, we do have a robust individual philanthropy system here. And of course, Cuyahoga Arts and Culture through the cigarette tax is also very robust. Does that affect how how the city affects. Well, we don't want the city to be last, but I think there may be some. We could rebalance it so there's equal amounts from our local government. But again, philanthropy is a very large part of why the city and the region does so well in terms of arts and culture.
That makes sense. I am the chair.
But it shouldn't, to the chair, shouldn't let us off the hook, the rest of us.
Fair enough. It's, when we're talking about proportions, I was wondering if that is perhaps why proportionally the city government may be spending, it look like it's spending less because proportionally we have such generous philanthropic adventures here. But
to the chair, that may be. We're still diving into the data some more. Happy to bring you into some of those raw data research
well, and
efforts.
if you wouldn't mind, let us know who our winners are from our individual awards. I'd love to send them some sort of formal announcement. Or I mean, like we should honor our successful artists, all artists, but especially the ones who are.
To the
doing so
chair,
well
I'll
here.
look to my colleague Deirdre McPherson. We can make sure all the council people here are aware of your
Absolutely. Such a pleasure.
respective winners.
All right. And so with that, I yield to the chair.
Speaking of winners, do you know who won a Grammy?
Duran
Who?
Bernard. Yes.
Incredible artist.
Yep.
Cleveland's own, to the chair, yes. Yes?
They told me that last night. Some people, I said, I don't know, and I'm from the Ville.
And there's also Elaine Martone, who's out in Shaker Heights. She's a multi-Grammy Award winner. She works with the Cleveland Orchestra but yeah, both of them. Classical.
Do you know how to reach out to them?
Yeah.
Especially from the top blooders, you know. Everybody want to be a top blooder. But back to the other piece. Yeah, I want to meet the young man and some of the musicians. We were talking about him yesterday. And I said, I don't know him. Have I ever gigged with him? That's what I was asking people, so I don't know. And he plays what instrument? Director, come to the table real quick. He's a vocalist? Yes. You have his tunes? You have some of his songs? I do, yes. I want to hear it. Not now, but I'm saying send it to me so I can see what's going on. Did he go to Glenville High School?
Yes.
I'm not sure he went to. I believe he went to Cleveland School of the Arts.
Oh, yeah, that's over there where we're at. So I should know him then. Because I used to go up and play with the kids, some children, sometime at Cleveland School of the Arts.
He's a Karamu kid, too.
Karamu, yeah. He
Oh,
is?
we say Karamu now?
Yeah, I always say Karamu. So reach him. I want to honor him on the floor. We sit back and we talk about him. Maybe even play some of his songs with some of the band members, and we'll do it up right. Because you have to acknowledge people. It's great to be acknowledged from your own hometown. It motivates you to do better and well. Well, you got the Grammy, you know, you can't do no. You know what that is, but we can show love to him. And I'll call you maybe later today or tomorrow. I'm so excited. Yes. Oh, wait. Councilman? Yes, sir.
Thank you. Almost good afternoon, but good morning. Appreciate the presentation. New council member for the Ward 12, Tanmay Shah. Appreciate your time. I just direct quick question on kind of the future as to the director through the chair. You were talking about thinking about the future and planning. I was wondering if you've seen some of the work that I think Iceland has done for providing guaranteed income for artists, and I wanted to see if there's been any of those conversations about how can we kind of work on that and what the data shows us. Because my understanding was that dollars are in return, and what we're seeing is far exceeding many other quote unquote normal expectations of what artists bring back to the community. And to me, I wanted to understand if there's been any of those conversations and what you think about bringing something like that to Cuyahoga County and Cleveland.
To the chair, to the council. Yes, there indeed has been conversations. I'll let Deirdre McPherson speak to
First off, thank you so much for bringing up that topic. I'm so happy and impressed that you are aware of that initiative in Iceland, that they have legislation for that. And absolutely, that is something that would tremendously impact Greater Cleveland and our creative economy to have a program like that, guaranteed income for artists. Assembly for the Arts, we did host a discussion on that, I'd say in 2024. It was a very popular and well-attended program, as you can imagine. Artists from every industry attended that discussion to hear about what is happening on that front. It's a topic that I hope is going to be covered in the cultural plan, and that we can really elevate the need for that, because artists are entrepreneurs. Artists are creating jobs. They're bringing people to our neighborhoods who are spending money, traveling from outside the region, and putting Cleveland on the map in ways that are really important. So to have that type of investment to continue the legacy of the Transformative Arts Fund, but to do that on a larger scale would be one of the shining lights coming out of our city. It's just, yeah, I'll stop there. But thank you for bringing that topic up, and we'll definitely be partners in that work, along with many others.
Yeah. No, I appreciate that, and thank you for the explanation. I look forward to providing any support or help I can in bringing that forth. I mean, you know, we've often talked about how our neighborhoods are exploited, and you know, these aren't poor neighborhoods; these are exploited neighborhoods. And to me, I think artists are the perfect example of people that are creating something out of nothing. And
Yes.
for me, it's something that we definitely want to be invested in and make sure that we support. So I look forward to that. Thank you.
And then we'll head right over to the lead.
Thank you, Mr. Chair. I did have one question about the slide, and it's a clarification question. Could you go back to it's talking about personal expense? It was a red and a blue graph. Yeah, that one. What, pray tell, through the chair, is a average personal expense as percentage of total expense? What does that mean?
So the data was gathered by SMU Data Arts. Every organization provides how much they're spending on all of their personnel.
Okay.
So that's their personnel expenses. So
Personnel, not personal.
personnel, personnel. An extra.
I know
N
how to
on
read
the
and
E.
everything, I promise.
It's kind of small, yeah. So it's personnel, not personal.
I'm like, what are personal expenses?
Personnel.
Okay, personnel, the cost of people. Thank you. My only other question.
Was that yours also, Council?
Yeah, it was mine. I just want to dig in a little bit so I can understand it if I can. Mr.
I'll wrap up here in a second. I'm sorry, Mr. Chair, I'll be brief. My only other question through the chair. You know, obviously there's been a big blow to the arts and cultural community in Cleveland. Recently when WCSB was taken off the air rather unceremoniously on World College Radio Day, and we lost programming that covered 40, 50 different, 60 different kinds of musical genres and art communities. Does the Art and Culture Council, through the chair, have any financial ties with IdeaStream or Cleveland State University?
Do we have any financial ties?
Yes.
We are not directly supported by IdeaStream or by Cleveland State University.
And through the chair, do you fund any programs for IdeaStream or?
IdeaStream is funded by Cuyahoga Arts and Culture. They are one of the 300 nonprofits that are funded by them. Higher education is a gray area. CAC does fund Cleveland Institute of Art, Cleveland Institute of Music. But Cleveland State is, I don't believe, is one. They may have a project, but also Tri-C, which is a tremendous arts music. We want to build some more bonds with our higher education. That's part of our future. Better partnerships, stronger partnerships with higher education.
Yeah.
And I agree, and we certainly respect how the city council did come out to speak about what happened with Cleveland State, IdeaStream, and WCSB. So.
The reason I'm asking, Mr. Chair, is I know that your organization has done a good job of respecting actual artists. However, arts and money can mingle in very unflattering ways. And when people with $500,000 salaries decide that they prefer one form of art over another form of art, they will typically use their power of their money and their position to sometimes silence arts and art forms that they do not care for, which is what we saw with CSB, right? And so I just want to be able to understand how the financial ties interact with the arts community when we know that artists can be trampled by wealthy people who have a lot of influence in the community. And I just wanted to, make sure that there's not any cross ties there. I didn't think there were. It wasn't my assumption. I just wanted to ask out in the open since that's what we do in the table.
To the chair, to the councilman, our charge is always sort of the biggest bang for the buck, the biggest policy that will impact individual artists overall, nonprofits overall, creatives overall. So we really take a holistic view although we are very aware of what's been happening. But we are really working on the long term. How do we work with the city, with the county, with partners, so that we could still have creatives, whether they have a lot of money, and many do not, so they could be impactful in our
When
society.
I was looking, Mr. Chair, at the, was it Nivea, NEVA, 20%, only 20% of local music venues turn to profit. I know that the college radio infrastructure has been a way to promote, to share events, to let people know about different concerts coming up. And a lot of those concerts are local artists, right? The Beachland Ballroom, the Grog Shop, these places, they feature a lot of local artists, people that are just struggling to make it. And they got, recognition, and they got airplay, and they got, attention through college radio, which then in turn sent people back to the Beachland to watch the bands, right? There's a whole community that gets, disrupted when we lose one of our radio stations like that. And it trickles into the profitability of many of our venues. So it is all connected. I just want to bring that up since we're here talking about it. I don't really have anywhere to go with the question. I appreciate the time. Mr. Chair, I yield.
Yeah, I'm going to yield to Councilmember Jones in a second, real quick. Downstate, temporary assistance for needy families, $10. Is there a way we could tap into some of that for the summer for children to take free music lessons, or to use it as a job for young musicians to teach children? TANF money. Probably you have to go through Jobs and Family Services. What you thinking?
To the chair, I love where you're thinking about this and love to talk to you further. We have not been looking at TANF or those other kinds of government sources for music lessons or arts type of instruction. That has not been within our purview. One thing I am looking at is how we can work better, for example, with summer jobs, summer youth employment. I know that Youth Opportunities Unlimited, they provided me recently with some data, something like close to 185 of their placements are with arts and cultural or arts and cultural adjacent programs, and 85% of those programs are right here in the city of Cleveland. There's room for growth there, but I would love to speak with you or to dive more into TANF. That is, I'm looking at my co-partners here at the table. Let's brainstorm on that. Would love to do that.
Yeah, I could reach out to some people downstate, maybe Kimberly Dent or someone. I'll give you her number later today, but I'll give a warm-up call first. And I think we probably could do that with TANF dollars, temporary assistance for needy families. And when you look at the abject poverty that's in the city of Cleveland, we might. I have an assumption, so I'll just reach out and I'll ask.
Working across the state is going to be key to our city's continued resurgence, personally, if you ask me, to the councilman.
And here's the other question. Are you going to Albuquerque, New Mexico this summer for the American for the Arts? And when is that?
To the chair, I'll defer to Deidre.
We did go to the Americans for the Arts Conference last year when it was in Cincinnati. I know we had thought about it. I think it'd be really great for us to go, have a presence there, represent Cleveland. There are a number of organizations in Cleveland that go as well. I think it'd be, we haven't confirmed it, but it's coming up. I'm gonna look it up right now.
Yeah, to the chair, we're sharpening our pencils and our budgetary, because Cincinnati was a lot closer than Albuquerque, so.
Oh, no, drive down there. I'm going to put on the floor to probably put together a national band. We end up playing. Because I played last, when did I play? Last year in November with the American for the Arts. I sat in and played with
June 2nd through the 5th in Albuquerque this year.
let me know what's what. Because I'm going to go. I'll be there.
To the chair, knowing you'll be there, that's an incentive for us to find a way. Thank you.
Councilman, sorry for taking up some of your, we move forward.
No, Mr. Chairman, I mean, certainly the liberty is to the chair. So I appreciate you giving me an opportunity briefly. My colleagues started hitting on the line of questions that was also a concern for me as well. And that was looking here at that same graph here where it talked about the difference in that trend, and it was significantly lower than the national level. And at one time, it was higher in 2022 and 2023 at the national level. What would you say is contributing to this spend that we see right now in 2024? And is it the same as it relates to 2025?
So the blue is the Cleveland. So we were rising to the chair. So we were rising in 2020, 23, and we've continued to rise.
Shape. We're in good shape.
We are certainly
According to national trends.
compared to nationals. Cleveland is an outlier in arts and culture, and I would also say through the chair that we want to look more granular data. Does that outline reflect just a few large institutions, or is it reflective? Some 60%, maybe between 55 and 60% of all arts organizations in our area have budgets under $250,000. 65, almost 60% have budgets under $250,000.
So what I would say, and first let me just preference with this. I think you're doing a wonderful job, Mr. President Johnson. You have been a great advocate since going all the way back when we first met. I said, who is this man keep blowing up my phone, calling me and knocking on the doors? And so you have done an absolute wonderful job in advocating for the arts. And I just wanted to give you those kudos because I see you always here, you're always engaged, you're always involved. And and these numbers somehow could be contributed to your advocacy for the arts, because there's not too many people in that field that really reaches out and touches us like you do. So I just want to thank you for your advocacy. And then also on that slide, would like to know the difference. What's making that difference, here in the city of Cleveland? Why are we an outliner? And if you don't know right now, that's fine. We could, at some other point.
To the chair, and thank you for the recognition. I greatly appreciate it. Yes, I am a tar bladder. So, Cleveland has always been a strong arts and culture city for a century. So this is not new. If you go to other places, the investments we have here are incredible. People come here from all over the world. We have, our industrial past led to philanthropists creating some 100-year-old institutions. So there is a long legacy. I don't want to start naming them, but you mentioned Karamu already, 100 years old. So Karamu in the traditional Swahili. So to the councilman, through the chair, I think that's why we have a long history of philanthropic support. Now with Cuyahoga Arts and Culture, that cigarette tax also makes us a national outlier. And the grass is always greener. So people look to us as a model, and we're also trying to get better. What can we do that's even better than the cigarette tax, or could be adjoined to the cigarette tax? So I'll dig some more into that data and happy to report back to you, Councilman.
I appreciate it. Thank you, Mr. Chairman, to Mr. Johnson, and to his distinguished team. Thank you for the work that you do.
I'll look into the temporary assistance for needy families. I'll reach out to you. I'll talk with Kimberly Dent, see what can we do about funding jobs for young children in the arts, and I'll see how can we try to dig into that money. Sometimes the states have a surplus of money. Sometimes just, especially with TANF dollars. I know we funded the Fatherhood Initiative through TANF money as well. I think we're doing that again with $10 million from the TANF dollars. So I see can we tap into that. I don't just work with the city. I reach out to the state as well. And I plan to reach out to the state on another issue soon. Anyway, we're going to talk about lead and kind of down a little bit on that. And I'll see you guys later.
Thank you.
Okay, thank you.
Thank you.
Oh, Jeremy.
Have you found greener grass on Canopy
Yeah, no.
Oh my God.
Wait.
You
Is
guys
that
get
a
to be in touch
documentary?
with the,
No.
the guy dealing with the Grammy, right?
Like
Yes,
7 or 8 years
yes.
ago.
Okay.
It's made its way to streaming.
Okay.
And we'll connect
Thank you. And thanks for asking about WCSB. We're just mentioning them, bringing them up.
Join the block.
Me too.
It's
one of those things.
Great
to know.
Jazz is like one
Mark.
of the wealthiest markets to fundraise.
in town. My mind
Thank you for being here. This is great.
And you know what? And Tom reached out to me this morning. So CP, he caught me. Tom, what you were calling me about? Tom McNair.
Oh, you want me in that seat? Is this
Yeah,
seat
this
okay?
seat right here. You called me.
Closer to us.
Yeah. You're going to tell us what's going on with the with lead and what issues and concerns we have right now. You know, this is the second hearing this this year, and I said, wait a minute, we got to get in touch, find out what's going on with lead.
Well,
Where we at?
Mr. Chairman, I think I'd like to start with Dr. Margolius, who I think has a more comprehensive view of the lead world. I think that there are some issues popping up with one of the grants that, again, wanted to let you know as we're learning about it. But again, I want to put it within the context of everything that you got so that you're getting your comprehensive update.
Yeah, you know, when I got the call this morning, I've been thinking about it, and it's in the back of my mind, and now it's in front of my mind.
Yes.
And, I don't like losing anything. I don't.
Yeah, no, me neither.
It's not good. And we'll yield. I was kind of waiting to Councilman Davis, but we'll yield. We'll move forward. See where we at.
All right, through the chair, thank you. So I recognize the time, and so I'll just go through the first dozen slides, which then segues into our grant performance. And the appendix is available for all of you. I believe you have the slides somewhere, so you can look through them at your own leisure, including some suggested amendments to the 2019 lead law that we'll talk about at a future date. So in 2019, as you all know, we collectively raised the alert that our lead poisoning rates were not declining despite all the good work and many good people doing this work. Our lead poisoning rates were double our peer cities at that time and 3 to 4 times higher than Flint, Michigan was back in 2015.
Slow down. You can slow down.
Okay, all right. And mostly that is linked directly to the age of our housing stock. So the older housing stock in a community, the more old lead paint there is. I brought in a sample if folks want to take a closer look at what lead paint looks like. It's in a bag, and so wash your hands afterwards. Don't open it. And so this is another picture that is in too many of our homes in the city of Cleveland, particularly problematic when it's like at the bottom left corner where it's a wooden painted window, and the friction from opening and closing the window creates lead dust, which ends up in babies' mouths. So what we learned from reviewing that data from 2019 to 2023 was that increasing the number of lead-safe certificates alone was not improving our lead poisoning rate. And we think the reason for that was because we found out that a number of property owners who were complying in order to pass the clearance exam, which was the standard at the time, all they needed to do was go into their homes and use a wet wipe, a bleach wipe, and clean out their window troughs and their windowsills and areas of their floor. And then the exam would follow, and they would be able to pass the test. And we have some examples of those here, if folks wanted to look. So in order to get a lead-safe certificate when it was just the clearance exam being required, a property owner working with a lead-safe worker could identify the areas of the house to clean in advance and then go do the dust wipes to look for lead dust, and there would be no lead dust because moments before, the day before, it had been cleaned thoroughly. And so we found out that just focusing on that one metric alone, increasing that number, was not doing the trick to reducing lead poisoning. But what is and what will be the trick is that the compliance with those lead safe certificate process, and also just separately from government funding and the private market, every single replaced or fixed lead hazard, so every new window, every new door, porch, fixed deteriorated paint, each of those contributes to reducing lead poisoning in our community. And furthermore, every new home built and every old home demolished is what will increase the likelihood that a baby being raised in Cleveland is raised in a home that doesn't poison them. And furthermore, it's important that if we're building new homes and we're fixing old homes, that those have to be the same homes where children and babies are raised in the city of Cleveland, because if the new homes just go to parts of Cleveland or neighborhoods or blocks where only adults live without children, then those impacts won't be felt across our community. And so the good news is we have been building new homes, tearing down and fixing old homes, training lead workers, ticketing and prosecuting property owners who do not comply, and spreading the word. I have some shout outs to some members here. So there's Councilman Conwell, the ribbon cutting of Davis Affordable Housing. Councilman Harsh is championing the modular home. Every new modular home is a home that will never poison a kid. Councilman Jones in the Southeast Side Promise, so the home renovation programs, each of those initiatives, and Councilwoman House Jones, sorry, the picture didn't show up there, some new homes in her ward. Each of those new homes is never going to poison a child. And so for each of these key performance indicators, the number of homes tested have been increasing. The number of homes upgraded or improved have been increasing. The number of homes demolished has stayed steady and continues to increase. New homes, new apartments, children's tested for lead, and children in lead-safe homes. And so as a result, for 2 years in a row, our lead poisoning rate has been coming down, and we're now at the lowest rate ever. And in 2026, that trend does appear to be continuing. And so absolutely not popping any champagne because the rate is still so high, but the state has us now at a number of 11%. We count ours internally at 14.5% because the state excludes when someone has a positive finger prick test and doesn't follow up. They'll include that in the denominator, but not the numerator. Whereas we only we don't we would count that in the numerator as well. But regardless, the state and our internal data have us declining over the last 2 years with this increased focus on getting lead hazards permanently addressed. And I think all of the seeds that have been planted by so many of you for the last 5 years are finally starting to take effect in our community. And so the question anytime I show those metrics, food for thought for later, is, do we have all the right metrics that we're looking at? How do we measure them, and how can the collective work that we do improve them? And then I have an appendix, which is data for each metric. And so this is the number of lead risk assessments and those more formal inspections that we do over time, and it's increasing in the fourth quarter last year. This is the number of tickets that we're administering in terms of prosecution. So property owners that aren't yet on the rental registry with a lead safe certificate has been increasing dramatically, starting especially last quarter. We're doing about 1,000 tickets a week. And the number of rental units currently certified with an active lead safe certificate in the city of Cleveland is nearly 30,000, though we know the denominator is at least much larger at 90,000. More folks are pulling permits to upgrade their windows and porches, and so we know not everybody who replaces their windows gets a permit, but at least the ones that do, that number is increasing. And then I will pause on progress towards our 4 grants and turn it over to Chief McNair. We have 4 grants, the Ohio Department of Development, and 3 from HUD, and we'll give an update on the progress towards those grants.
Thank you, Chairman Conwell and members of the committee. So this is something that's been kind of rapidly evolving that we wanted to let you guys know about as soon as possible. But it was late last year, kind of closer to the holidays, that we received word from the Ohio Department of Development. And they had been communicating with the Department of Community Development kind of throughout this grant period. But the ODOD Lead Safe Ohio grant program, those were ARPA-funded dollars that came in. I think Building and Housing originally made the application, but about $5 million came into the city that was awarded to be administered through the Department of Community Development. And again, they kind of heightened awareness to us that they were beginning to have some concerns about us being able to meet our timeliness deadline. Because those are ARPA funds, they needed to be spent down by the end of February. So again, there was about $5 million that came in from that. They asked us to kind of get a list of all projects that we had in the pipeline, where we're at. We scurried. We were working with our implementation vendor for that contract, which is CHN Housing Partners, and pulled a lot of that stuff together. I think part of what we found and part of the challenges that we were experiencing was a couple-fold. One of which, that program had a cap on the amount you could spend per home of $15,000. It also required that each one of these homes get that lead clearance certificate, right? So, and the dollars could only be spent on windows and door replacement. And as Dr. Margolius knows, that is one of the largest issues facing ed. But in Cleveland, right, rehabbing a home to get a lead clearance certificate takes much more than just windows and doors, which was causing our implementation vendor to use blended funding sources, which was really slowing the process down. So we were able to work with ODOD, who generously, kind of within the constraints of the program, tried to make it as flexible as possible for us to be able to spend those dollars as quickly as possible. In that, we're able to lift the cap of dollars spent. They're also enabling us to spend dollars on more than just windows and doors so that we can include things like paint, all of which makes it easier for us to do these things. Because like I said, the constraints of the program essentially turn these into like mini occupied rehabs of homes, right? Which is much more complicated than just saying, go replace windows and doors. We found out mid last week that the state, they kind of came back and said that these projects that are under contract, under construction, fully signed off on can stay, but they are going to repurpose the remaining portion of that grant, which means there is $3,289,000 that the state is reclaiming to spend in other areas. They have also let us know that we are not the only major city in the state of Ohio that this is happening to. So I think that we do feel that, again, I think given the great need there is around lead in the city and the way that program designed, it was a little more challenging to spend. But again, we have done everything that we can do over the course of the last 4 or 5 weeks, both working with the implementation vendor, exploring a variety of options, right? But the state made it unequivocally clear that what, you know, they are in the business of, right? They are not going to allow these dollars to get reclaimed by Treasury by the end of February. And so if there are projects that weren't contracted, scoped, ready to go right now, they were not going to, we tried very hard to get an extension on these things, but they let us know that they will not allow for extensions with the exception of the Haven Home project. We're able to identify about $150,000 in window and door replacement in there that they can utilize. But beyond that, they would not be issuing an extension that they needed to move forward with repurposing of this. Again, grateful to the state for allowing some flexibility that is making us easier to get these. I don't like any more than you do the idea of repurposing these funds. I made it clear to the state that I understand that they are in the business of ensuring that Ohioans benefit from this before going back to the Treasury. We let them know that we are in the business of helping as many Clevelanders as humanly possible, because this is one of the biggest issues facing our city. But again, this is something that was kind of brought to us at the end of 2025. And we have done an extraordinary amount of work in a pretty compressed timeline to try to ship this as much as possible. And because they're able to change some of the parameters of that grant, I mean, we were at like $200,000 of work, so the fact that we're able to reclaim about $1.6 million to use here, I think is some progress. But again, I think as we talked about it, we wanted to let you guys know this as soon as possible. So again, the dust is not settled on this. We have not changed any contracts, but letting you know where that grant stands.
With the grant, I don't like losing money at all. It's not good. So what you said is by the end of February, you have to have the money spent. So when they gave us the dollars, the grant, the gift, did we know the timeline was the end of February, or did they just changed it?
Yes, sir. We have known the timeline for the grant was awarded a couple of years ago.
We knew it was coming up. So if you see that you have February, so who was monitoring the grant? What compliance?
So this
What was
was
going
being
on?
operated through the Department of Community Development. There have been a lot of changes within that department over the course of last year. Again, broadly, I've been trying to dig in as much as I can to home rehab, right? Lead being one portion of that. Peeling, there's a lot of layers to that onion to peel back, so to speak. But it wasn't until ODOD flagged this, which again was probably mid to late December, where they said, we are having a real issue here, let's get together and talk. And we were able to get together internally with staff members that are working on this, Dr. Margolius, who's, as you know, intimately involved in our lead response, as well as the implementation vendor, to try to better understand what we could and couldn't do.
Would it? Yeah. Well, let me finish this right here. I thought that the grants would have a sunset in June with the ARPA money. So the ARPA money would leave us and it go back to the state, and the state will give it to the federal government. Is that how that goes?
Yeah, through the chair.
I'll put it down.
So that's right. So ARPA really has a December 31, 2026 from the Department of Treasury, from the federal, but the state had created a timeline of February, knowing that they would have this option to reallocate funds that were not spending as fast. And so they've basically looked at money from urban areas where money wasn't going as fast and are reallocating them to some of the rural areas where the money was being spent quicker.
That's what I figured. And they got nervous because we weren't moving. And Chief, did they give you a progress review on it? Because, when you get a grant, you know where you should be at with your goals. And your objective is to complete it in February. And if you didn't complete, let's say, 80% of it by September or October, we know we have issues in February.
Yes, sir. So again, my knowledge is that they were communicating with the Department of Community Development. Again, this is something that was kind of out there. Again, as we know, there's been a lot of transitions in leadership levels up there, and so
I know.
I think some of this was moving parts going around. I was unaware that any of this was happening until, again, it got elevated by ODOD in late December. But
did they have a chart or anything that they were?
yeah, we were
monitoring it?
substantially behind, right? Again, I think we had at the time 17 homes completed over the course of 2 years now. Now, again, I think one of the things that we found was that the parameters of the program that were set up, which again, I think we all know and understand that lead poisoning is one of the biggest issues facing not only Clevelanders, but residents in the state of Ohio. And they set up a program that was broad-based forever. But again, when you're talking about a legacy city like Cleveland, which lead is more prevalent, right? You think of it is everywhere. Most residents of our city can go outside right now and go out to their flower beds. And if you take a sample of the dirt, you're going to find high lead levels.
Yeah.
It is everywhere. So a $15,000 grant to simply replace windows and doors that also requires lead clearance for that home, right, isn't nearly enough money. And so my understanding is what that started to do to try to meet the requirements that set forth was bring in other grant sources of fundings and create a layered finance approach. And again, it really turned this into kind of like a mini occupied home rehab, which is very complicated and was taking too much time and not spending the dollars down fast enough.
So Tom, who was doing the compliance?
So that was, I think Gina Ventry was the bureau chief that was overseeing this program area. I believe she departed last summer-ish that was in there. So that was kind of the program area that was living within the Department of Community Development. And again, CHN was our implementation vendor. And again, we did everything that we could in a pretty truncated amount of time to work with ODAD to try to get them to, now again, they have their own program requirements they need to meet, right? They don't have the blanket ability to say, oh, you need to make this easier here, do this. But like within those program requirements, they have been helpful in both listing that cap amount above $15,000, as well as allowing for more things to be covered by the grant with things like paint, which makes it way easier for us to get through there. And we thought, this is great, and if we're able to get an extension, we may be able to substantially spend down a portion of these funds. But again, ultimately they made the decision that like February 28th was a hard deadline. They were not going to grant an exception. So all the number of homes, of which I think we have 63 applications pending, right, that had gone through contracting, have scopes done, they would allow those to stay in.
I was going to ask you that.
But the larger pipeline that we had been developing, and there is a large pipeline. They
So
were
when
not
you
going
let
to grant
those stay in, would that reduce the $3 million that,
So it was originally 5, right? And again, when we started this conversation, I think we'd spent a couple $100,000 somewhere in that neighborhood. So again, because that they were generous enough to kind of change some of these guidelines, again, within the parameters of which they could, that's what's enabling us to spend this additional $1.4 million to get out the door.
Right.
And try to help as many folks as we can.
did they give us timelines on the spending $1.2 million, $1.3
That was
million?
where they did not budge, right, was issuing some sort of extension. Had they been willing to, and I think we were hoping for that June extension, we did have a pipeline of homes. We felt that we could substantially spend down most of those funds. But again, that was ODOD's decision.
So who is the they? The they. Who is over that department? Who is they? Is it?
The Ohio Department of Development?
Yeah.
So we have been working primarily with Luke.
You burn a letter down to them. You talk with the state reps, state senators.
We
You talk
have
with the
been working
governor.
directly with the Ohio Department of Development on this, all the way up to their assistant director, right? So this has been a pretty comprehensive conversation. And again, they let us know that Cleveland is not the only major city in the state that this is happening, but that they were not willing to risk the idea of these funds not being spent within the timeline, that they had other projects that were ready to go that only needed funding. And so again, that is the decision that the Ohio Department of Development made.
So what the other cities are saying and doing, can we work together with them and we reach out and talk with our state reps, state senators? It's our residents' money as well. And we can talk with the governor and people like that. I mean, we got to fight. You have to fight for everything that we have.
I understand that, and that is what we have been doing for the past 5 weeks, is doing everything that we can to work with ODOD to allow us to capture and utilize as much of these resources as humanly possible.
And they're going to give it to other.
They have not let us know where these are being allocated.
What you thinking?
That they have other areas and projects that are ready to go, and that there is no risk there, and they are doing this around the state, right? And my guess is that this is not just big cities versus rural areas. They are looking to reclaim these dollars wherever it is they can to put into projects that they know are ready to go right now, so that they can ensure. They said quite plainly, and I understand this, what they won't do is risk these dollars that they are returned to the Treasury. These are going into windows and door usage for the state of Ohio. Right?
Because we are so far behind. What they're looking at is that you have compliance, and they're not hitting. They never hit their benchmarks. So they're saying, so the odds and the probability is that we're not going to, and it's going to go back to the federal government in the long run. And so they want to give it to someone else who's executing on their projects. That's what they're really saying.
Yes.
And so we don't have any supporting evidence that we will hit our numbers. And Tom, you were not the chief at that time when it was pushing through. It was other people who didn't monitor and control it, because you have to monitor and control grants. And now we're caught up in this right here. So did you take a look at the other grants that was going on with compliance? Because sometimes when people energy compel them to be a certain way, then you got, where there's smoke is fire. So you know that there's other grants out there dealing with this, and their system is flawed. You're doing what?
Yeah, so we are, and this is where I mentioned, right? I'm spending a lot of time right now with the team in community development trying to better understand the home repair side of things, where we have a lot of dollars that are flowing in and out, and better understand the process, all the different, I mean, there are a myriad of different grant programs for that. There are a myriad of different funding sources. There are a myriad of different implementation vendors, right? And trying to get a better understanding of how all that works and how we get it to be better.
Right, now you meet with them how often, and they give you feedback and reports and what?
I am spending a lot of time with folks on the third floor right now. Right, and you know, I do want to say that I think Interim Director Anderson, right, put in a pretty tough position. There were a lot of folks that kind of, again, there was several different transitions that occurred in there all at once. Never lost on me that Interim Director Anderson has her own area that she is overseeing and kind of stepped in to kind of help coordinate a handful of these things. But we are spending a lot of time on the third floor, broadly speaking. And again, part of this is we look at the creation of the new Department of Development and what are the pieces that are coming out of community development and bring together with ED, something that, again, I think makes a ton of sense, is going to be hugely beneficial. But as I've told many people, and we'll talk more about this at the budget hearings, right, it's a hell of a lot easier to pass a piece of paper, right, than it is to operationalize changes like that. That is a very complex thing where we're
execution is the key.
That is correct, sir. Like taking out those housing pieces and kind of putting them together with the other real estate pieces in ED and kind of forming that, and then simultaneously spending a lot of time in the Department of Community Development right now trying to better understand the different pieces that remain, right? We're in the process of interviewing for a new director of community development right now. That's going really well.
You're doing a national search.
We have done a very comprehensive search. Oh, sure. So there were 176 applications, I believe, for that job posting. I think we went through close to 30 initial phone screenings, have been whittling way through, but very pleased with the direction that is going. Hoping within the next 1 to 2 weeks to be able to have somebody be announced there. That's a big piece of the puzzle, right? Finding the right person to get involved up there, and then again, charting that new direction for a department that is really focused on neighborhood revitalization efforts that are going on. But home repair is such a huge part of that, right? And probably the most complex piece for me, right, in terms of when I talk about peeling back the layers of those onions is like, because it happens in a couple of different bureaus, there are a multitude of contracts, a multitude of different vendors, right? And like just trying to better understand how it works, what's working, what's not working, how we get it operating better.
So let me ask you this question, and I yield to. So I like Ms. Anderson, but she probably, I'm saying probably, I don't know, never ever had to look at systems or structures that large. Saying that, we need somebody even in the interim, and I like her, don't take that I don't like her. I think systems all the time. We probably need to put an interim person right there right now while you looking to look, or you audit all the other grants.
Yes, so there are a couple things. One, you know, again, I have known Interim Director Anderson for a number of years, and you know, one of the reasons that she was selected and things that I liked about her is given her institutional knowledge in the department.
She have a lot of institutional knowledge.
So again, has she been overseeing these pieces? Is that kind of her area of expertise?
That's what I'm
all
saying.
the different ones of them, not necessarily, but when things pass her desk, she has at least an idea of like, what's going on. She kind of flags me at the right points, and so we have been working through a lot of that. And again, I think we are very hopeful to have a new director for that department and start the rebuilding of that staff in earnest in the very near future. We have also been working, Catherine Tkachek, who is the former Director of Government Innovation for Cuyahoga County. If you've not met her, super sharp young woman that has a lot of experience in this work, and she has also spent a lot of time doing interim Cs since she left the county. We have a small contract with her where she has been working in the department, really interviewing different people in the bureaus, trying to pull together, like, here's what the org chart looks like, here's where your open vacancies are, here are the different things that these different bureaus are kind of getting into, here are potential issues and challenges, right?
Yeah, you want to look at the risk.
A very, kind of matter of fact, it's not saying this is good or this is bad, really more just here's what is happening, which, again, I am trying to make sure that when we bring a new director in there, that they can really hit the ground running and kind of get them up to speed as quickly as possible, because, I think this is a scenario wherein I consider myself, right, I worked a lot with that department over the course of years. I know it relatively well, and, it's like you like lift up the hood and it's like, wow, there's a lot to get your arms around. And there are many people that have been up there for a number of years with deep institutional knowledge in one piece or another, but trying to get the overall comprehensive glance at how it works is a different story entirely.
So let me ask you this, then I yield.
Yeah.
Let's go down there. Let's try to get that money back. I'm serious. We burn a letter, and we try to get that money back. Because you can't, the way I look at things, I don't like to lose anything. I don't like to lose it. And if you're thinking, I don't want to step on your toes to do what I'm thinking right now, but you give me the game plan, and we try to get that money back. Because sometimes people will say, well, we're not going to give you the money, we'll move it here, but if we go down there and we protest and talk with some senators, talk with the state rep, reach out with the governor, try to meet with his people, you got to fight for it. You got to fight. Isn't that right, Councilmember Joe Jones? You got to fight for it, yeah. I do know him down there, yeah. Yeah, I do go down there. And the big guy, yeah, the big guy down there.
I mean, the governor.
Yeah, so we got to fight. Sometimes they have to see us fighting for it, but the numbers, I don't know how bad our numbers are. I just don't know.
Happy to continue to work with you. Again, I think the biggest enemy that we have here is time.
I think so, too.
Those dollars need to be spent in the next 19 days, right?
Mr. Chair.
And that was where and so, again, I wish I was aware of this earlier.
You went into it. I said earlier you fell into but you had a baton now, but you fell into that, and I understand why. I understand why they did what they did, which is terrible and it's horrible and it's hurting children, it's hurting people, and that's just not good. So I'll talk with you if whatever you think. I don't want to step on you guys' toes, and we might go down there at least for a conversation. And I'm going to yield. Look at the prevention on the other programs. Look at them right now. Because if this hit, because the person that was there before, I'm going to say, sometimes you don't have to say what you say. And that means it might be, the energy compels them to be that way. That means there might be some other ones at risk. You see what I'm saying? And we'll do that. But I'll talk with you later. I'm going to yield to my colleagues. That was Councilwoman Hudson.
Thank you, Mr. Chair. I just want to get some clarification. So originally we were given $5 million. What was the year that we were given that grant, that it was awarded?
Through the chair, Council, it was over 2 years ago, I believe.
I can pull up the legislation in a second.
And so the state is taking back $3.2 million. Is that correct?
Through the chair to the councilwoman, $3,289,000.
And the money that you're saying that's already been allocated for these projects that are coming through the pipeline, that's part of the money that has already been spent and that's not included in the $3,200,000? Or are we still trying to spend it down?
Through the chair to the councilwoman, that is mostly correct, right? So what you see on there, that 63 applications received, right? Like that is part of the money that they are allowing us to keep in the contract, right? Those are projects that are under contract, fully signed off, scope of works are done for home, and those are the ones that they said, all right, given the additional flexibility that we're going to allow within this program, we feel confident that those numbers can be hit and you can keep those within the contract, right?
Okay.
When we started the conversation 4 or 5 weeks ago, right, we weren't going to even be able to do those numbers,
Okay.
right?
And so when was the change made to allow for expansion of things you could spend the money on so that you weren't requiring on blended sources of funding? When was that change made?
So through the chair to the councilwoman, without giving you an exact date, because this has just been a myriad of phone calls and emails going back and forth, it was within, say, the last 2 weeks. Along with that is when we asked for an extension to the program to June because, and again, do have some emails where we've kind of been going back and forth with numbers and looking at, a pipeline of homes that the implementation vendor has been kind of pulling up that we felt if they could extend till June, I don't think we would hit the full 5 million, but it was right up, there would have been a handful of hundreds of thousands of dollars that would have been repurposed. So we fought very hard for that extension before. Again, it was like Wednesday of last week. They said, no, this is what we're doing and the direction we're moving.
So do you have a concern with this new expansion that if we are able to go to Columbus and advocate for, retaining these funds, do you have concerns about being able to get these funds out the door?
So through the chairman of the council, I think undeniably, right, we had only completed 17 homes within a 2-year time period, which I think we can all say is not great. Right. I think that there are a lot of reasons for that. And I think that as we really dug in with the Ohio Department of Development staff within the city of Cleveland, as well as our implementation vendor, and trying to understand the whys, we were really struggling at this. This is where we came up to if we do these things, we think this should be able to flow. Now, to directly answer your question, we haven't done it yet, right? We think that we have done the things that is going to make this easy to flow, but until we show that we can actually do it, I cannot say with 100% certainty that if all the money came back in, we would be able to spend $4.5 million over the course of the next 2.5 months, right?
I have concerns about the speed with which you're proposing to spend this money, and things that would come along with that.
Understood. And again, through the chair to the councilwoman, Dr. Margolius pulled together a really fantastic one-pager the other day that outlined all the challenges with the regulatory challenges that make it so difficult to spend a lot of these monies, right? And I think that's where we all have to be very cognizant that it is not just a staffing issue or an implementation vendor issue. Oftentimes it is the places that you get these dollars from that just have layer upon layer upon layer of a variety of regulations. It is very complex. And so, I do appreciate that when the state, say, creates a program like this, they are looking at it very broadly to impact as many areas in the state of Ohio as it possibly can. But I do think that a part of it was that, some of those regulations make it more challenging in a place like this where the need is so great, where, again, you can't both say, you must get lead clearance for this home. You can only spend $15,000. you can only do it on windows and doors, right? Because if you can only do windows and doors and you can only spend $15,000, there is no way you're getting a lead clearance certificate for almost any home inside the city of Cleveland, which then turned into an extraordinarily complicated cobbling together of additional sources from other government grants, right? Which turned this into kind of a regulatory nightmare. So again, I think that we all feel that the burdens that they are saying, all right, well, we'll lift that cap. We'll allow you to use paint, and a few of these other things are going to make it easier. But we have to do it, right? And that is, you know, again, when I say it's like I understand the state's goals here, my goal is to help as many Clevelanders as humanly possible with these money, right? Period. End of story. Like that is it. And so, you know, when all this stuff seemed to be going sideways in the way that we were looking at it, I think we very quickly shifted into how much of this money can we actually deliver on right now, because we don't have the gift of time in this. And while I don't love the state's decision, certainly, I understand the position that they're coming from in their refusal to risking returning these dollars to Treasury, and them saying, if you cannot spend these right now, and again, I think we do know that it is more complicated here in the city of Cleveland than in some places where you can just walk in and replace windows and doors for under $15,000 in a home, you know, have that lead safe. And they're like, we have projects like that right now that are ready to go, and that's where we're going to put these money because we're not risk sending it back to the federal government.
Monitoring control them on that, Chief.
Is the, this is my last question. Do you know what the state is proposing to use this funding for? Is it related to lead safe remediation, or is it something completely different?
So through the chair to the councilwoman, yes, this is still the Ohio Department of Development Lead Safe Ohio grant, right? The purpose of it is to replace windows and doors to abate lead in properties, and so that is their intent. They have not told us exactly what projects they're investing in or where they're going. They have only told us that, one, that there are a great many places throughout the state of Ohio that received allocations, that were able to spend their money easily, that have further need, that are asking them for more money, and that Cleveland is not, certainly not just the only big city, not the only place in the state that has had challenges executing these dollars, and so they are working broadly throughout the state to repurpose dollars where they can, to put them in areas where they know are ready to go right now, that they have contracts available that they can move. But it will be for lead windows and doors.
Thank you. So we need to convince the state of our need, but also that we're prepared to change our path to get these funds out the door.
This is a conversation I wish we would have been involved in several months ago.
Thank you.
Before I yield to Joe Jones, last year we were given, I think it was the state or the federal government was going to take lead money from us. How are we doing right now? Keep an eye on that.
Through the
Make sure
chair.
we're hitting our benchmarks.
So that's the bottom half of the
Yeah.
slide. And so those are the HUD grants, including the Glenville
the
grant.
HUD grants.
Yeah, and so for about 3 years, every report card we got was red. And this past quarter, for the first time ever, we've got 2 greens and 1 yellow. And so we are making progress, but you know, understand that we're going to have to bring that same type of accountability to these other grants and keep pushing forward.
Because we were going to talk about the HUD grants.
Yeah,
today.
it's on this slide right here. The Glenville grant is the formal name is the Lead High Impact Grant, High Impact Neighborhoods. And so you can see in each of those grants, we've gotten an extension, a 1-year extension. And the life of the grants was 5 years. We're in the 6th year, and you can see the production over the past year relative to the whole 5 years. So work has been speeding up, but continues to be very difficult to spend government money on home repair.
I'll yield to the rest of them because I talk with you guys all the time anyway, and we'll see what's what. Joe Jones, and then you, Councilmember Hart.
You know, while you were speaking, I was saying earlier, when you called my name out, that you're the only one of the very few council members that I know that goes downstate and meets with the governor and lobbies.
Within 2 weeks from now.
Yeah, and do work for Cleveland. So I just want to thank you for your leadership in doing that. Now, this here is troubling to me on a number of fronts, and it ain't no way you can sugarcoat it. What I will say is the presentation was very professional and very clear and transparent. So I appreciate that. My concern is the same concern I've had since I've come back 8 years ago, back to this council. And we talked about how dysfunctional that department has been, community development, and how it continues to be dysfunctional. When you can have a department, when I look at these numbers here, this is mom and pop shop. This is no kind of shop that the city should be operating. Our numbers should be vastly larger than this. When we can have, Community Housing Solutions numbers, they're getting rid of more money than what we are getting rid of. And they're doing far by more projects than what we can even blink our eye to. And they're our partner. So my suggestion would be cleaning the shop up. And it was my suggestion early on, cleaning the shop up and getting the shop in a place where it can function. And one of the things, Mr. Chairman, because this is going to be an ongoing issue, and I just want to make sure that the administration clearly hears this, is that you're going to have to be able to get rid of those funds quicker when they come through that department. And I even made a few suggestions too. And some of them seemed like they had heard it, and I saw some of the formulation and the policy change as relates to how do we get money out to our contractors quicker? How do we create a strong contracting system? And one of the biggest issues that we're having right now is getting these funds out, getting them into these projects, and getting them moving and getting them mobile. And the solution, or at least part of the solution, of what I heard back in the 2024 by then Mrs. Hernandez, was that they were putting together a system whereby they would be having a major contractor, someone who would be responsible for, having the bulk of this part of the administrative function coming up out of a more professional operation so that we can get these funds out quicker and faster. Because the council has been sitting here also bottlenecked, not just in this administration, but administrations years past, and trying to get funds out to the people and to the citizens. There's a real reason why we have the distinction of being a city in poverty, is because we're failing to get those funds out to the neighborhoods quicker and faster to save them. And when you can't get these funds and resources out quicker and fast enough to save these neighborhoods and these communities, they will continue to go down and slide down the route and path that we don't want. So I guess the question is, have we begun the proposition to barter with the state to say, okay, if you take these funds from us, can we get something in exchange for it? Have we started those negotiations? If not, my suggestion would be that we do start looking at ways in which we can swap those funds. Because again, we got to remind the state of the reason why the city of Cleveland is so important to the state of Ohio. And one of those reasons are many. But one is we are an absolute engine in the state of Ohio. We're an actual cylinder. We produce resources and money for the state. And we have to remind the state that we are a partner too, and we do have needs. And if the city of Cleveland is to be strong and survive, we need every single penny that we can possibly get and every silver nickel that we can get to keep this city stable. Because if we lose the city of Cleveland, then the Republicans who are getting all these funds from us won't have those same funds to run their operation. So it's in their best interest, I would think, Mr. Chairman, in their best interest to make sure that we get all the resources we necessary can get. So I would ask if we could barter that. Now, going back to these other cities in your slide, this is another issue that is important to me to kind of understand, and I'm not sure if you may have the answers here because I know both of you gentlemen are not really over that department. But it's the cities of that you've listed here, where their compliance is lower than ours in terms of lead poisoning, and how we are double the rate. And that would be Toledo, Akron, Detroit, Cincinnati, Columbus, and Austin. And in terms of good practices, my suggestion would be, Mr. Chairman, to the director, what are we doing, what are they doing different from us that's causing for their lead to go down, and they're in similar situations that we're in?
Through the chair, thank you for that question. So they have newer housing stock than we do. That's the number one reason that they have a lower lead poisoning rate. When you look at the average age of homes that were sold in Cleveland, 65, we're working on getting a metric of just period how old homes are, and we'll do that by neighborhood. But Austin, Texas, for example, has an average age of home of 8 years. 8 years old is their average age of housing stock. And as you can imagine, they don't have lead poisoning. And so that's why part of the highlight here is all the work that this council has done in terms of building new housing. And I recognize that alone is not going to be sufficient or fast enough, but I would encourage you all to continue to do that great work of supporting construction of new and affordable housing.
Well, Mr. Chairman, I would just say, as you got the slide up here and you see that fancy picture of that nice councilman up there, no, swing it back to the other one. No, swing it back to the other one. Right there. He on the news fighting. And he has his picture up there because he's talking about bringing housing into the city of Cleveland. So, and I'm glad that you pulled that slide back out, because see, this is the issue right here that we're really fundamentally faced with. How do we improve our failing housing stock? And one of the issues and one of the challenges have been, and it's been frustrating for me sitting down here at the end of this table, because every time, and we talked a little bit about this with the director, when we asked them, what is it, what resources do you need to have to help you improve the situation, we're lied to. At least that's one of the previous directors and building housing director. What was his name? O'Leary. And so at the end of the day, he lied to us here at the table. Now, I understand that you can't do but so much at the end of the table if you're not the boss. It's just like having Trump in the office. People who oppose him, he go after them. I understand that. But what I would share with you, which is really important to me sitting here at this end of the table, talking about building and housing, we're going to have to do better in that department. We're going to have to do way better. And then I would suggest that one of the things that we talked about in that caucus meeting was the factor that we should bring our financial institutions to bear here at this table, because they're now opening up their pocketbooks to help make it affordable for Clevelanders to not only purchase homes and rehab homes, but to build new homes. And then I would suggest, and I would say to my colleague Chris Harsh, who's done a wonderful job in trying to get, I can't think of those, modular homes, trying to get the modular homes in the city of Cleveland. I would just say we need to look at how we get developers from other cities. Because what I'm looking at right now, I'm looking at other communities outside the city of Cleveland building a lot of homes, brand new homes, entire neighborhoods and communities. And the question I have in my mind is, why don't we have that here in the city of Cleveland? Why aren't we doing that here in the city of Cleveland, building new homes? What I am seeing and what I have seen in the last 8 years or so is a lot of rental properties. We're giving money to people to develop rental homes and rental properties. And right now, Mr. Chairman, to the gentleman here at the table, we don't even have the right laws in place to protect those who have rental properties from stopping their landlords from going up double the prices and kicking them out of their homes. So there's a lot of work that we need to do at the council level as well as the administrative level to develop the partnership to really put together a real housing plan that is going to be something that's going to have an impact in a positive way at the city of Cleveland. So lastly, ending with that as a suggestion, I'm not going to beat you up here at the table about your presentation. I think that we need to try to barter to get those funds back as best we can. If we can give Jimmy Haslam that money out of that fund, then we should ask them replace it out of that fund for us. And we'll use the Jimmy Haslam as a leverage to get money from the state of Ohio because we're losing $32 million. Is that a year? We're losing it when they left here? Is it $32 million we're losing a year?
Through the chair and councilperson.
I think we should use everything we got to show leverage to be able to get more money back in the city of Cleveland is my suggestion. So with that, Mr. Chairman, thank you. And I don't know if Tom McNair wants to say anything. He's really good to this or what.
Through the chair to Councilman Jones, I will just say that one, greatly appreciate all the work by Dr. Margolius and his team to go through this. Again, we're here at Health and Human Services, and I think want to make sure that we're kind of keeping this focus on lead right now. I think we all know and understand that housing in Cleveland is an extraordinarily complex issue and one that we need to get our arms around. Fundamentally, Councilman Harsh and I talk about this a lot. Our housing market is simply underwater, right? In that it costs more to build a new home than oftentimes you could sell them for, and so ultimately I think a lot of what you're talking about is right, and there's a lot of work for all of us to do. But I think, we should all not be naive enough to think and understand, look, this is a dollars problem, right? Philadelphia just came out with a new $2 billion housing plan that included an $800 million bond, $40 million for rehab, $25 million for soft mortgages, like all these sorts of things, right? Oftentimes when we talk about budgeting within the city of Cleveland, and again, this is a city with an infinite need and a very limited amount of resources, right? We're viewing it through the human beings that are working in these departments and small dollar amounts that go somewhere. It's nowhere near enough money, right, to figure out kind of some of these large scale, the capital necessary to really kind of eat at some of these issues. So again, that is a much bigger conversation than simply right here at Health and Human Services, just focus on lead, but it is one of the critical problems facing the city of Cleveland and something that we all need to continue to have conversation, figure out the right solution for.
Well, I really appreciate that. That was a long answer, but and you certainly gave Dave Margolius a shout out. So I think you're doing a wonderful job. The only reason why I asked the question was because my initial question that I asked, Mr. Chairman, to Mr. McNair was, how do we deal with the issue? And it was new housing was one of the suggestions. Yeah. And so we haven't faced the issue of new housing as we should. So that was the reason why I gave that suggestion. So if you mentioned in citing another city that is making that, Philadelphia is what you said, is making these kinds of investments, then we need to get serious like Philadelphia and make those same kind of investments in terms of new housing. So how is Philadelphia doing?
So through the chair to Councilman Jones, again, spending a lot of time right now getting our arms around what a variety of different municipalities throughout the country are doing related to housing. And, we can and will attract a modular housing. That is a part of it, right? But ultimately, I think to do the things that we need, there'll be more capital than currently exists in this conversation, and that's where we need to figure it out. Yeah.
No problem, Mr. Chairman. I yield to the chair.
Thank you. Mr. Chair, I appreciate the moment. I'm not going to beat a dead horse. We're losing some funds that we desperately need. But I do want to ask this through the chair. I've become growingly appreciative of good bureaucrats, people that know how to work within a governmental structure and get things done. And one of the main things that we hire people for here at City Hall is to manage programs. And I know that the community development director is supposed to answer to the mayor. I know he put a person sort of in between there, and your predecessor and the previous community development director are all gone. So my first question is through the chair to the chief. what work are you doing to ensure that all other programs are accounted for and properly, that we have the timelines figured out, and that somebody's assigned to those programs to manage them and make sure that if any deadlines come up, you're made aware of it with enough head time to do something?
So through the chair to Councilman Harsh, as I mentioned, that is something that we are actively working through right now. So spending a lot of time on the third floor, getting to know folks, better understanding the way things operate, actually kind of doing a contract audit right now with all these other things to better understand. And again, some of this is just my education, right? I'm not saying, to your point, there are good folks that are kind of working on some of these things, right? Like, but I can't be helpful if I don't have a good baseline understanding of where things are and how they're operating and where the challenges are. You know, one of the things that is my expectation of whoever we come in to run that department, I care way more about your problems than your success stories right now, right? Like, until we better understand, all right, here's program X, Y, and Z, and here's the challenges with it. Like, that's the stuff we really need to dig into. We will celebrate successes as they come, but we need to understand problems. So that is part of that kind of audit that I talked about is going on, and I hope to have more information on that.
And
in the
through-
near future.
Through question to his evaluation audit.
Sure.
When will you be finished with the evaluation process?
To the chair, I think we are, again, hopeful to, within the next couple of weeks, at least be able to announce a new director of the Department of Community Development. Obviously, it'll take a couple of weeks to get them in the building here. Like, I want to have that stuff done by the time they get in the building so that we can kind of say, here's what's really going on here. So within, you know, the next month or
Great
so.
question. Then when you finish with it, and then we know, we need you to come back to the table to tell us, at least to give us a progress review on the overall audit.
Yeah.
All the books up there, so we know where we're at. There's no
Understood.
surprises.
Understood.
One,
Well, the chief said, what you think? I don't want to put words in your mouth. What you thinking?
Well, I should have drafty something within the next 3 or 4 weeks, right? And again, kind of broadly, like what are all the different contracts? Where are they going to? What are the deadlines for those contracts? Like, are they, you know, how close they are to, are they in a good shape? Are they not in good shape? All that kind of stuff.
After, and I hate to interrupt, budget hearings, and budget hearings is when?
Like in the next couple of weeks.
We got next week.
After that.
Next week.
After
soon.
budget hearings.
Yeah, but
Then what we'll do the audit then after budget hearings. And we'll find out where it's at.
Mr. Chair, one last question, if I may. Through the chair, I know that Chief McNair, you came in a little bit past the ability to do exit interviews, but I also know that the previous community development director lost her right and left hand a few months before leaving herself. Has there been any effort to reach out to those individuals, some of those high-ranking people that probably have really good insight about maybe different projects that they were sad to leave but felt they needed to?
Yeah, so through the chair to Councilman Harsh, but don't mind saying this stuff, right? Like, have an outstandingly good relationship with Tony Scott, former assistant director, who's now over at Cuyahoga County. He has actually been extremely helpful when
Wonderful
there's
to
been
hear.
things that's like, hey, don't know what's happening here. What is your interpretation about that? He's been happy to help and share with there. You know, Tony Bango is somebody that I've known and been friends with for probably over a decade. There's been, that's a little bit on the other side of things, but like as we've kind of heard things like, hey, like what's going on with this? He's happy to pick up the phone.
Sometimes
So
we just
they
need
have
to
been-
recover information.
Yeah, 100%. And you know, Tony left a really good transition report that was put in there that's been very helpful in and of itself. You know, so again, I simultaneously trying to dig and figure out as much information as possible to piece together, and like on particular projects, if there is phone a friend opportunities,
That's where I'm
taking
getting at.
advantage
Sure.
of them.
Okay.
Chairman.
All right, thanks.
And Mr. Chairman, just, you know, one of the things I also want to suggest too is that when we have good employees, we pay them. And I've had to sit here at this table and tell the council pay their people too. So when you have good people, pay them And so to lose some of this talent that you're talking about, these were some really good people we lost. And so I would suggest, Mr. Chairman, moving forward.
But she wasn't executing, council member.
No, I'm not talking about her. I'm not.
You know what I'm talking about. She was executing.
I'm not talking about her. I'm talking about some that have left that were really good folks, and we want to try to I would say, try to do the best we can, especially in critical positions. You know, we try to see what it is, because we almost lost another couple of directors. I had to get on the phone and talk to them and beg them to stay because they were just that good, and the city couldn't afford to lose them. And one of them, I'll tell you in private who it is, Mr. Chairman.
Okay,
But at the end of the day, if we can afford to pay some more extra to our people who do a good job, you know, I think you two gentlemen do a good job, and I think that we should pay you, that you've earned your wage and your salary.
You know what? Do me a favor. Anybody that, let's say attrition, we lose or we execute, that before they leave, we audit them.
Yeah, exit interviews.
Exit interviews.
Yep.
Anybody, we do the exit interviews, and then we audit too, because it's not fair to the new person to come in and you never audit.
Yep.
No, you see what I'm saying? So that way we know where we're at, and it started from a clean slate.
Everything I can to set this new individual up for success.
Got it. So what's your plans when we go downstate, or we do what? What you think? My assumption is they're not going to give that money up, and they've already planned with it, what they're going to do with the money.
So Councilman Conwell, yes, it seems like they've made it very clear what they're doing here. I think to Councilman Jones's point, we've been spending an awful lot of time with the Ohio Department of Development, ensuring that there is a good partnership there, and understanding that there may be situations like this where they have to move in a certain direction, but making it clear what the priorities are for the city of Cleveland, where we need their partnership and how we bring more resources into the city.
So what are you thinking? Because I remember, now I'm not going to talk about them. I don't like losing money, lessons learned. Where you at?
So, again, I feel probably largest lesson learned here, again, not to wait until 2 months before the grant period closing. I do think that if this was a conversation that we were having several months ago, whether it was making the type of adjustment we did here at the end to see if that can really move the needle, or are there more drastic measures we need to take to find ways to get the dollars out the door. Again, I know that they had been communicating with the city of Cleveland, but I think on my level, just trying to make sure that I stay a little bit more aware so that, and that's why I said it's like the thing I ask most from folks, the directors of our departments that within our cluster, I want to celebrate all your successes, but make sure you're bringing me your problems, right? Can't help if you're not coming to me like at our check-ins with like, this is not working out well, we have a real challenge here, how do we address it, right? That to me is, one of the most important things that I need to work on moving forward.
I hate for us losing money. And if we put together a plan, I don't want to step on you guys' toes. Go downstate to get the dollars, but I want to say this about you, Chief. Very, very good. And you execute when I stop by, just like with you. I'll call you whenever, and you execute well. And every time you have told me something, it's like you turn around and you get it done. And I hate, but you got the baton now, and you got to look at this. You've executed very well, and I hate you got to deal with this right here. But we're dealing with it too, so
Yeah.
we deal
Yep.
with it all together. And but I called you back this morning.
Yes, I saw.
And I was
Thank
headed
you.
in. Let me know what you thinking. Will I see you later tonight?
I believe, yes.
You think we need to go down there? You think we need to
Well,
burn
let's
a letter?
chat later tonight.
Okay.
It'll give me some time to think on it throughout the day.
Yeah, because if I go and you not, it gets goofy.
Understood.
Yep.
Okay.
We'll meet. I'm glad to see the Arts Committee.